So we want to start, but we need quorum. So if any member is in the room, please, if you take your chair, your members take chair so we can start. Thank you. Good morning again. We have 20 members stay. We have quorum. So, Mr. President, we can start.
Good morning, honorable ministers, delegates. We will begin this morning's session with item 7.1, report on strategic issues between PAHO and WHO. I would like to bring document CD 62/INF/1 to the attention of the Council and invite Mr. Ronnie Mazza, Director of the Department of Planning, Budget and Evaluation of the Pan American Sanitary Bureau, to come to the head table. I now yield the floor to the representative of the Executive Committee to report on this item.
Thank you, Mr. President. Item 7.1, report on the strategic issues between PAHO and WHO. The Executive Committee reviewed the report on strategic issues between PAHO and WHO at its June session. The committee expressed appreciation to the Bureau for facilitating participation by PAHO member states in the global processes, including the negotiations on the new pandemic agreement and on the pathogen access and benefit sharing system. In that regard, the importance of formulating regional positions and statements on issues of priority importance to the region of the Americas was underscored. Delegates also welcome the coordination between PAHO and WHO in strategic planning processes. The importance of ensuring sustainable and equitable financing for PAHO was stressed, as was the importance of multilateralism and regional and global solidarity in safeguarding health. It was also pointed out that while the distribution of resources among WHO regions has improved, continued effort is needed to ensure that the allocation of the region of the Americas adequately addresses the region's needs and reflects its importance for global health. Thank you, Mr. President. That concludes my report.
Thank you, Minister. I now yield the floor to Mr. Mazza to present the item.
Good morning. Mr. President, Assistant Director, Deputy Director, Honorable Ministers, distinguished delegates, I am pleased to introduce item 7.1, report on strategic issues between PAHO and WHO. And I will provide a few updates based on where we left off at the Executive Committee in June. As noted in the introduction by our President of the Executive Committee, this report, its aim is to provide an update to Member States on high strategic topics related to PAHO's engagement with WHO on leadership, governance, accountability, and transparency, and how we here from PAHO, your secretary, and with you, member states, contribute to such important topics at the global level, but with relevance to the region. This report dates back from 2018, so a lot has changed since then. And we try to keep up with updating it because since then, member states, and we have to acknowledge that, have had the opportunity to participate in consultation processes, in briefings that WHO colleagues have also been doing with the new technology that we have now, especially after the pandemic where everybody's connected now. But we also acknowledge that for some smaller delegations that are not in all the WHO governing bodies meetings or in all those briefings early in the morning, as soon as 3 a.m., we bring value to that. And your secretariat is pleased to do that constant briefing and updating to you. With regards to the key topics that I'd like to highlight here, I think yesterday you had a comprehensive update by my colleague, Dr. Ugarte, on IHR and health emergency-related matters. But let me just highlight that during this period, in the last 15 months that we're reporting here, we indeed work with you to ensure that the region's perspective contributed to WHO's governance on the global health emergency architecture. And as you know, the INB pandemic agreement was agreed at the Assembly, and this region, indeed, as Dr. Ugarte has highlighted many times, and the chair of the region, Ambassador Tovar, again, the co-chair, Mexico, also their role in leading that process with all member states was important so that the region be heard. We continue to facilitate the collaboration with WHO, and then the next important collaboration is on the with the issue to facilitate your participation in engaging and contributing to the pathogens access and benefits sharing system through the Intergovernmental Working Group. Again, this is where we continue to see where we have the opportunity to brief you in addition to your participation in the global consultations or briefings. With regards to budget and financing matters, also thanks to your advocacy and continued call for more equity in the budget space allocation, but also in financing, we are pleased to note here that the program budget for 26-27 was increased by 14%. Again, that budget was approved at $254.8 million, and that's budget space. But as I will highlight again, the important contributions here, and to address a couple of questions we got earlier this week about how do we contribute to global prioritization. Well, the program budget for 26-27 was built with a more evidence-based approach, more systematic prioritization, which I'm pleased to tell you that the regional experiences contributed to also improving the prioritization process in WHO for the global program of work, but also the program budget for 26-27. Our results culture, we have continued to exchange with WHO our experiences and practices on results and accountability. And we are pleased to share with you, as you look at what you approved there, and there was more consultation, more engagement with member states, but also a more priorities-oriented and results-oriented program budget. And we are happy to tell you that the regional experience, again, with your input, contributed significantly. Just to note that from the region, I believe we had over 30 member states who contribute to the prioritization that also help to inform the program budget priorities for WHO. No, but concretely now in terms of funding, as of the end of last month, we had received $201.4 million from the WHO allocated to the region. That again is an increase by $31 million compared to the full biennium, the last biennium 22-23. That's again thanks to your advocacy and call for more equitable funding to the region per the budget that was approved. We continue to echo your requests, and our director and our senior management and our teams continue to ensure that WHO sees the value of directing those resources here and contributing with results that we and sound implementation and accountability that we have here in the region through our PAHO systems. However, As we note that increase in funding, we also note that the region continues to be the least funded region. As some of you have highlighted already, we don't just have the smallest budget, but we have the least level of financing, which at the end of August was 66% of that approved budget, when other regions average about 75%. So that is something that we need to alert you and to ask you to continue advocating. No, as we continue to work with you and our colleagues in WHO, we will continue to put forward the priorities of the region, the needs of the region, ensuring that they understand that this region also has needs, and that's why our member states also contribute, of course, with their own quotas and, importantly, with their own results to the global agenda. In concluding, I'd like to highlight that PAHO's collaboration with WHO is a testament of our region's constructive role in shaping global health policy and ensuring that strategic decisions reflect the needs and priorities of the Americas. So please keep voicing, keep attending, keep engaging at that level as well. Your secretariat, our teams here, will continue to collaborate with WHO during sharing PAHO's lessons learned and experiences, but also all the necessary information to ensure that the global health agenda and the priorities of this region inform such agreements and proposals at the global level, with the information that you provide, but also echoing your needs. Thank you for your attention. We are pleased to collaborate with you and continue engaging so that our region's priorities and the needs are well reflected at the global level, and that we continue to respond to you, our member states, as necessary. I look forward to any questions or any information that you may need. Thank you, Mr. President.
Thank you, Mr. Mazza. I now invite the Directing Council to take note of this report and provide any comments it deems pertinent. I open the floor to the plenary to begin the discussions. Brazil, you have the floor.
Thank you, Mr. President. Brazil is grateful for the presentation of this report on strategic matters between PAHO and WHO. We recognize the efforts undertaken to strengthen the engagement of member states of the region in global health fora. We underscore the importance of the PAHO's contribution for the active participation of member states in discussions about the agreement on pandemics and the amendments to international health regulation, such that we can make sure that regional interests be reflected properly, offering a unified global approach to health security. As a representative of the Americas at the directing body of negotiations in Geneva, Brazil took part in the 13 rounds that led to the adoption of the agreement on pandemics in May, and will continue acting actively in subsequent talks, especially about pathogens and benefit sharing. Now, regarding strategic planning, we stress our support in drafting the 2026-2031 strategic plan of PAHO aligned to the 14th General Working Plan of WHO. The consultation process with broad participation by member states is noteworthy and contributed to a more inclusive and equitable agenda. Brazil thinks that sustainable financing and one that is equitable is the more favored option. We think that at the summit of G20 in Rio, and those talks strengthened WHO's financial standing and also the America's contribution to global governance or of health. There is, however, a mismatch in the allocation of resources across the different regions that aren't properly, or the needs and strategic role or of the region is not properly reflected. We saw that during COVID. The double contribution of our countries to WHO and to PAHO should be recognized as a positive aspect and not as a disadvantage and understood as an equitable distribution of resources from WHO. We think that we could do even better, Mr. President. We congratulate Dr. Jarbas Barbosa for his leadership at the helm of PAHO. PAHO can continue counting on Brazil's commitment to defend an equitable distribution of resources, to bolster its presence among countries, and to promote cohesive global leadership. Thank you.
Thank you, Brazil. I now give the floor to France.
Thank you, Mr. President. I will be speaking French. Mr. President and Director Didier, we'd like to thank PAHO for its leadership in the continent and the quality of its cooperation with several offices that are focusing on the health ecosystem in the world. We are welcome to what has been adopted by WHO at the World Health meeting. After 3 years of intensive agreements, this is strengthening the preparedness and response to emergency situations in the world. The Pan American Health Organization plays an important role to support the countries of the region during the negotiations. This has to continue to achieve consensus in the Intergovernmental Working Group preparing the annex to the agreement. France supports the process in the region of the Americas for 2025-2026, in focusing on what is on the digital preparation, NCDs, vaccination, mental health, and fighting for the health determinants. France welcomes the negotiations to prepare the PAHO strategic plan 2026-2030 when the WHO is going through programmatic restructuring. We think it's essential for member states, in particular in our regions, to ensure consistency in this process. The prioritization and deprioritization in the region has to be done with close coordination with headquarters to ensure that we provide the best conditions for health of everyone. France will provide its support for all the activities carried out by the headquarters and by regional offices. Thank you very much.
I now give the floor to the Bahamas.
Thank you, Mr. President. We thank PAHO for this timely report on PAHO WHO strategic issues. It reflects notable achievements, such as the adoption of the pandemic agreement, strengthened regional coordination, and advances in planning and financing. We commend the Bureau's role in support to member states' participation, ensuring the Americas continue to shape the global health emergency agenda. But we must move beyond recognition to critical reflection. The pandemic agreement is a landmark, yet its value will be decided by how it is implemented. The Bahamas remains committed to the regional process, and we thank PAHO for its ongoing technical collaborations thus far and requests PAHO's continued support for access to tools and capacities required to turn legal text into real resilience at country level. Mr. President, on financing and planning, we welcome the alignment of the PAHO strategic plan with GPW 14, and we also note the associated budget increases. However, the 14% cut in regional offices' base budget raises concern. The Bahamas remains committed to continued advocacy for a more equitable share of resources and requests PAHO continued efforts with strengthening mechanisms to ensure sustainable and predictable funding. Finally, on accountability, the new results report portal is a step forward, but transparency must lead to action. We call on PAHO to support member states in using this information to close gaps and to sharpen priorities. I thank you.
Thank you, Bahamas. As I see no other requests for the floor, I now yield to Mr. Mazda to respond to the comments.
Thank you, Mr. President, and to Brazil, France, and the Bahamas delegations for their comments. I will just address a couple points. Indeed, we continue to address this constant, sometimes misunderstanding delegate to Brazil about the PAHO quotas and the WHO quotas, and to ensure that the budget that's approved for the region is indeed funded at the right level. So that's something that we continuously work with our WHO colleagues to ensure there's full understanding that the member states also, as they decided before WHO was created, that they contribute to this organization should not affect the funding of the regional budget that's approved by the World Health Assembly by you as well, because you do indeed contribute to the organization of WHO just like the other member states. With regards to France, yes, indeed, we continue to look at how we benefit, how we contribute. We benefit from the process at WHO. We are applying, as you rightly noted, in this prioritization exercise and restructuring that WHO is doing to see what is applicable to the region. And we have committed that as soon as we complete our operational planning here in the region, we'll also inform WHO the relevant information. Just to let you know that we are using similar approaches to prioritize or deprioritize, as you put it, in that scenario planning that Director Jarvis already mentioned earlier this week. Bahamas, thank you for your comments. We indeed are looking at how to safeguard the priorities, but also the country focus. What you see there is regards to the budget allocation. WHO had a 20% cut, and they had to distribute that. But luckily here in the region, we also have the PAHO budget, where we bring that balance. And of course, a commitment of our director is to protect our countries as well. Thank you so much, Mr. President.
Thank you, Mr. Massa. I now yield the floor to the Assistant Director for her comments.
Thank you, Mr. President. Good morning, delegates. On behalf of Dr. Barbosa, I'd like to thank member states for their participation and facilitation in two areas, pandemic preparedness and emergency response, and also the budget allocation. Over the 3 years before we actually finalized the pandemic agreement, the Secretariat was very pleased to assist member states in that process to have that agreement finalized in the World Health Assembly. Secondly, the budget allocation. It's through your advocacy to WHO that we have been able to get this far in terms of budget allocation, but we realize that we still have a way to go, and we want to implore you, member states, to continue for that to ensure that we have that fair allocation to our region. Specifically to the Bahamas, the Secretariat has worked with you, member states, to have the pandemic agreement. Rest assured that we will continue to work with you and be with you at your side in its implementation. Rest assured as well that from executive management or technical teams here at PAHO and in the country offices, we work with the WHO Secretariat to ensure that the region of Americas, that we have a voice and that we continue to participate in the governance and technical areas that will benefit member states. So again, thanks to you for the pandemic agreement negotiations, and we implore you to continue to advocate for a fair allocation of resources to our region. Thank you.
Thank you, Assistant Director. I would like now to inform the Council that the discussions will be noted in the final report. We now move on to item 7.7, Policy and Research for Health, the final report. I would like to bring document CD62-INF/7 to the attention of the Council and invite Dr. Sebastian Garcia Saiso, Director of the Department of Evidence and Intelligence for Action in Health of the Pan American Sanitary Bureau, to come to the head table. I now yield the floor to the representative of the Executive Committee to report on the item.
Thank you, Mr. President. Item 7.7, Policy and Research for Health, final report. In the Executive Committee's discussion of the final report, delegates expressed appreciation for the technical support provided by PAHO during the implementation of the policy. Research for health was seen as a driver for developing effective treatments and innovative solutions to persistent health problems, devising life-saving public policies, combating misinformation and its consequences, and strengthening health systems and ensuring their sustainability and reducing the gaps in health faced by millions of people in the region. The importance of continuing to invest in research for health was underscored. Support was expressed for the actions recommended in the report, including strengthening institutional capacity for research, improving transparency, and increasing national and regional investment in science and technology. It was pointed out that technical and political commitments are also needed to strengthen national capacities, ensure adherence to the highest ethical standards, and promote innovation and knowledge transfer. Thank you, Mr. President. This concludes my report on the item.
Thank you. Thank you. I now yield the floor to Dr. Garcia Saiso to present the item.
Thank you. President of the 62nd Directing Council, honorable delegates of the Executive Committee, Assistant Director, and colleagues. It is my privilege to present to you Agenda Item 7.7, the final report on the policy on research for health. This report responds to the mandate issued in 2009 through Resolution CD 49R10, when the Directing Council adopted PAHO's policy on research for health. The aim of the policy was to promote the generation of relevant, ethical, and high-quality research, which entailed strengthening research governance, standards, and competencies, and fostering the dissemination and use of research findings to advance health. This report marks a significant milestone. It provides an assessment of the progress made in the last 15 years and the pending challenges to conduct high-impact research that is relevant for the needs of people in the region of the Americas. Research saves lives. It is necessary to find cures for diseases and effective health interventions. The COVID-19 pandemic was a powerful reminder that research has a direct impact on our health, our well-being, our economies, our security, and our self-sufficiency. The pandemic also revealed the strengths and limitations of our research ecosystems. It showcased the measurable progress made by member states over the past decade and a half. Highlighting some of the results over the time this policy has been in place, the research output of the region has increased dramatically. Publications in the health sciences have increased almost 10 times in the last 15 years. The region has made significant contributions in priority areas like Zika and malaria. And the growth of innovation in some areas, such as biotechnology, has exceeded the pace of traditionally stronger research economies. The Pan American Sanitary Bureau has continuously provided technical cooperation to develop research agendas to meet health needs and to strengthen frameworks to align with international ethical and regulatory standards. Only in the last 5 years, 12 countries have developed new research regulations that adhere with international standards. And recognizing a vastly different research governance landscape, the region has developed tools and guidance to conduct ethical research efficiently, enhance the impact of research results, and ultimately ensure that evidence informs health decision-making. Being the Americas the only region that has produced criteria to accredit research ethics committees and templates for clinical trial agreements, which have accelerated efforts to strengthen national research capacity. To support the use of evidence, PAHO developed BIG and Big Rec platforms, which include more than 150 guidelines and 3,800 recommendations developed by national authorities in the region using great methodology and categorized by health topics and regional priorities. However, some challenges persist. Chief among them is limited investment in health research. Despite progress, public funding for research in Latin America and the Caribbean remains far below global benchmarks. Studies tend to be small and repetitive, thus not capable of yielding high-quality evidence. Logistical and regulatory barriers hinder the conduct of large-scale multi-country clinical trials led from within the region, limiting the potential for truly impactful, coordinated research efforts that meet our region's needs and thus address persistent disparities. Despite improvements in governance, many countries still rely on frameworks that cover only a subset of health research or unduly restrict valuable studies, such as pediatrics and pregnancy research. Confusion between regulatory and ethical oversight leads to both duplications and failure to take on essential tasks required by international standards. Along with stronger research capacities, efficiencies at the regional level ought to be devised to accelerate clinical trials that meet the needs of the region. The report emphasizes several key lessons that should guide us moving forward and harness the power of science for health. A systematic approach to research governance, rooted in indicators, is essential for sustained progress. Trust in scientific research must be nurtured. We can only do research if people enroll as research participants. Transparency is key to foster research participation and trust in research outputs. Scientific research is foundational to development. Investment in research not only advances health, it generates economic and societal benefits, including jobs and economic growth. Research is necessary to reduce disparities in health and well-being. Health for all will only be achieved if low and middle-income countries are capable of leading the innovative studies that meet their specific needs. We must therefore promote locally led research, support young scientists, and build regional capacity in emerging areas such as genomics, AI, and precision medicine, where the region can also have a competitive advantage. Scientific research only saves lives if its results guide practice and policy. We must ensure the uptake of research results and devise strategies to ensure health decisions are systematically informed by evidence. The report concludes with a clear call to action. It urges member states to scale up efforts to advance health research, to improve the quality and impact of clinical trials, and to act on the lessons learned during the pandemic with support from the Pan American Sanitary Bureau. The Directing Council is invited to take note of this report and offer its views on how we can deepen and sustain this agenda and take further action to ensure research translates into better health and greater well-being for the people in the region of the Americas. The Secretariat remains committed to working hand in hand with all member states to ensure that research for health continues to be a force for progress, innovation, health, and economic growth in our region. Thank you, Mr. President.
Thank you. I now invite the Directing Council to take note of this report and to provide any comments it deems pertinent. I now open the floor to the plenary to begin discussions. I give the floor to Jamaica.
Mr. President, Jamaica thanks the Secretariat for the comprehensive final report tabled on the policy on research for health. Guided by the PAHO policy on research for health, we have made notable progress towards the strengthening of the national health research system. We have established a governance framework for research for health through the introduction of an essential National Health Research Committee. We have established a Research for Wellness Fund to support research to inform the wellness initiatives of the ministry. In 2024, Jamaica applied to become a part of the EVIP-NET, and we are now moving towards the drafting of a national policy for research. Despite progress made, the in-country experience reflects the challenges mentioned in the report, including the need for capacity building, collaboration in the conduct of clinical trials in emergency and non-emergency situations, and in strengthening research governance and oversight. The experience of the COVID-19 pandemic indicated greater need for the ethical oversight of research to be entrenched in law. The pandemic also highlighted the need to quickly pivot to other areas of research in emergency situations. Strengthening of the governance framework for research will require capacity building in specialist areas such as biostatistics, data science, and epidemiology, among others. Jamaica notes the tabled final report on the policy on research for health and supports further initiatives to be supported by PAHO to draft a new revised policy to address the health research challenges identified. Thank you.
Thank you, Jamaica. I now give the floor to France.
Thank you, Mr. President. France has seen the progress and efforts by PAHO in the governance of research policies and the implementation of indicators and having regional health research carried out. And this shows the willingness of the Secretariat to implement rigorous projects. Many challenges nonetheless exist. The importance of having quality information made available to the public and to look at the sanitary institutions. There is coordination also to the brain drain that occurs in the scientific area and that is affecting all the research activities that are carried out by the countries. It is necessary to invest further in research in all areas in order to accelerate the development of innovative technologies. We encourage the implementation of what is described in this report to be carried out by countries. Thank you.
Thank you, France. And I give the floor to Paraguay.
Gracias, presidente. Delegados, Paraguay resalta la importancia de la
Paraguay it finds it important to invest in research as an essential function for public health and a key tool to eliminate inequities and to have evidence-based decisions. We note the final report on the policy on research for health that shows the gains achieved in the region in the past 15 years. My country agrees with the targets and recommendations outlined in the report, which are in keeping with the national frameworks that exist in our country, such as the National Policy for Ethics in Research for Health, the National Policy for Research and Innovation in Health, and the Priority Agenda for Research and Innovation 2023-2030. These instruments seek to consolidate a research ecosystem that is ethical and relevant, focused on the chief needs of the population. Paraguay has reinforced its policy framework through Law 7064/23, creating the National Researcher System with its regulatory decree 1585/24 and ministerial resolution 379/25 that provides guidelines for accreditation and operation of research ethics committees. These provisions are in keeping with the regulatory framework of the National Directorate for Health Surveillance, guaranteeing quality, safety, and ethics in research. Our strengths include the political commitment, the existence of operational ethics committees, working with research centers and universities, the experience learned during COVID pandemic, and a growing scientific production. Nonetheless, there are challenges such as to increase sustainable financing, to strengthen technical capabilities, consolidate infrastructure for clinical trials, and translate knowledge into public policy. Paraguay thinks it is strategic to move forward in emerging areas such as AI, genomics, technological innovation, and strategies to retain and repatriate knowledge. In this context, we ask PAHO to continue supporting the strengthening of capacities, regulatory harmonization, promotion of regional networks, and mobilization of resources to close gaps in middle and low-income countries. Thank you very much.
And I'll give the floor to Brazil.
Thank you, Mr. President. We thank PAHO for presenting this final report on the research for health. Brazil recognizes the importance of this topic, especially at a time in which fake news are growing in proportion with unprecedented results. That's why we place an emphasis in this document on the need to strengthen institutional HR capacities to broaden national and regional financing in science and technology, and to ensure ethical and transparent governance of health and research. This year, The Osvaldo Cruz Foundation, Field Cruz Foundation also, has been around for 120 years in promoting health research since Carlos Chagas, who described the disease that carries his name, and other scientists that created the first national platform for RNA messenger and other breakthroughs in science in cooperation oftentimes with other countries. Field Cruz has made itself available to the countries of our region and other regions to strengthen global health. Along with other health institutions, it plays an important role not only in research but also in training human resources throughout the region and of the global south, and in the production of vaccines and medications. Aligned with the principles of this policy, the Lula presidency has prioritized the articulation between science, technology, innovation, and public policy on the path toward equity and social justice. The Health Ministry of Brazil has invested in research projects in women's health, rare diseases, oncology, and neglected diseases. This is a very important decision that was made by our country, for our country, expressing the clear commitment that scientific knowledge should be placed at the needs of the real needs of the population. It's important to underscore that Brazil's experience in implementing the research governance body in health has played an important role to strengthen quality, effectiveness, and the social pact of scientific evidence. Within this context, we reiterate the strategic importance of research in health as an element that structurally will strengthen the structural approach to health, as well as our commitment to an ecosystem of innovation that is geared toward the populace's needs, promoting broad access to the results of research. Ultimately, scientific knowledge is an essential contribution to continue saving lives during a time of fake news. Thank you.
Thank you, Brazil. I now give the floor to Cuba.
Mr. President, Cuba, during the pandemic, tested the capacity to change research time. This meant we rapidly adapted regulation to look at the introduction of reactions and responses based on research. Cuba adopted the idea that health is a social product and carries out research with multi-sectoral participation, looking at the problems from the viewpoint of society, families, and patients. Access to medicine and other essential health technologies is a world priority and a basic component for access and coverage that is universal. Some countries face access to bioelements due to high prices and lack of manufacturing. Creation and strengthening of national and regional capacities for the development and production of raw material and medicines and other essential health technologies is crucial to respond to health needs of the region. It is therefore necessary to have access to sustainable financing, strengthen research, develop and transfer technologies, and to have national regulatory systems that have been strengthened and that are in keeping with international standards. During the pandemic, Cuba, in addition to creating vaccines against COVID-19, was able to produce for its own internal needs as well as for those of other countries, despite the limitations to our export capacities. We have a biotechnological and pharmaceutical industry in Cuba that wants to respond to the needs of the national health system and achieve sovereignty. Cuban pharmaceutical industry covers 62% of the basic framework of medicines produced by BioCuba Pharma, with more than 9 million registrations. As a measure for the protection of local industry, the Public Health Ministry does not import as a final product what can be manufactured in the country. Industry must be prepared to face the emergence of new technologies, shorten the life cycle of products, increase international competition, service demand, and the emergence of new diseases. Therefore, it is advisable to have collaboration and exchanges with other countries, and in particular with those of our region. Thank you very much.
Give the floor to Mexico.
Thank you very much, Mr. President. Mexico acknowledges the importance of promoting solid ecosystems to develop research for health in the region. Scientific research is a key component of the national agenda of our president, and we want to improve our regulatory frameworks, promoting the right environment to carry out clinical trials and work on strengthening our most valuable resource, that being human resources. These efforts not only can provide better options for diagnosis and treatment to our population, but have the potential of generating an important economic overflow. We're grateful for this final report on research for health, and we call upon PAHO to continue reinforcing technical capacities in the region and promote an increase in the number of multilateral trials and in research networks. Thank you very much.
I now give the floor to the Dominican Republic.
Good morning. The Dominican Republic acknowledges and appreciates the presentation of the final report on policy and research for health of the PAHO. This document recognizes research as an essential health function and a strategic pillar to guarantee the quality of service and preparedness for emergencies. The results of the report will guide and strengthen national efforts in the research field, promote generation of scientific evidence of high quality, and guarantee the results of such research so they may become health policies and programs. The report shows important advances in the region, such as having regulatory frameworks, developing research agendas, creation of regional networks that are evidence-based, and the increase of scientific production, especially during the COVID-19 emergency. These progress confirm that investment in science is investment in health, well-being and development. It is particularly good for the country to look at recommendations to strengthen the national investigation research aligned with different planning instruments in countries, strengthen research capacities and ethics committees, promote research in science and innovation and emerging technologies, and we share the concerns stated about the scant financing and brain leaks, which affect our nation as well. We therefore think we must continue strengthening regional research opportunities and promote evidence-based research, as well as coordination with academia. We reiterate our gratitude for presentation of this report and assure our commitment nationally, ensuring that scientific evidence become policies that are effective, equitable, and focusing on achieving well-being for our populations. Thank you.
Give the floor to Honduras.
Thank you very much, Mr. President. Honduras concurs with the strategic report presented in this document in 7. Policy on Research for Health final report. It recognizes research as a key function of public health, indispensable to promote equity, evidence-based decision-making, and preparedness and response to health emergencies. We also concur with the need to adopt a systematic approach encompassing ethical governance, scientific integrity, transparency, sustainable financing, and strengthening capacities at all levels. In this framework, Honduras believes it is important for this document to explicitly recognize the situation of member states that find themselves in a policy transformation situation. In September 2025, the Health Secretariat, CESAL, authorized the development of a policy on ethics of research having to do with health. Right now, it's in the technical phase prior to its final validation. This process is being carried out in keeping with PAHO guidelines and in close coordination with the General Office for Policy Development and other national bodies. CESAL incorporated research as a strategic line in its sector areas, as a guiding light for evidence use. We're also developing a national agenda for research priorities, focusing on the country's health challenges, focusing on the vulnerable population. Honduras recommends inclusion in the report of a section recognizing such efforts. Furthermore, there's a need to develop regional studies carried out jointly to empower technical and financial cooperation, strengthen research networks, and guarantee greater production of quality evidence that has an impact on the health of the peoples of the Americas. Thank you, Mr. President.
The floor to Guyana.
Mr. President, Guyana welcomes the final report on the policy of research for health and commends PAHO for advancing this important agenda across the region. We recognize that research is critical for evidence-based policymaking, innovations, and equity in health. At the national level, Guyana has taken steps to strengthen research capacity through collaboration with PAHO, CARFA, the University of Guyana, and other academic partners. We have developed research mechanisms for ethical oversight and are using research to inform programs in maternal health, NCDs, malaria, and mental health. The Ethical Review Board actually receives over 1,500 proposals every year for review. However, challenge remains, particularly in financing research infrastructure and the shortage of trained professionals. To address these, Guyana call for PAHO continued support in building capacity, strengthening research governance, fostering regional collaboration, and mobilizing resources for priority health research. Guyana reforms its commitment to evidence-informed policy and supports the continued integration of research for health as a central pillar of PAHO technical support. And to note that Guyana will be hosting the CARFA Annual Research Conference next year in May in Guyana under the theme Innovations in Health. Thank you.
Thank you, Guyana. I now give the floor to Trinidad and Tobago.
Good morning. Trinidad and Tobago extends its appreciation for the final report on policy on research for health and takes note of the progress achieved in advancing research governance and capacity across the region. We recognize that health research is indispensable to reducing inequalities, guiding evidence-based policies, and improving health outcomes. At the national level, Trinidad and Tobago is working to strengthen research systems and align with international standards. Recent initiatives include assessment of our evidence ecosystem with international partners, the 2024 STEP survey on NCD risk factors, and the hosting of our National Health Research Conference with a focus on digital health. These demonstrate our commitment to a stronger, evidence-informed health sector. Our priorities for research include non-communicable and communicable diseases, maternal and child health, oral health, and digital health. We also acknowledge the importance of responsibly integrating emerging technologies, including artificial intelligence and genomic medicine, into research and health systems. Mr. President, Trinidad and Tobago reaffirms its commitment to advancing health research nationally and regionally and to ensuring that the best available evidence informs our decision for better health outcomes. Thank you.
Thank you, Trinidad and Tobago. I now give the floor to Panama.
Thank you, Mr. President. Panama notes the final report, Policy on Research for Health. Its purpose is to promote relevant, ethical, and quality research, which implies strengthening governance standards and skills when it comes to research, and to encourage the dissemination and use of the results of such research to promote health and inform on results achieved in relationship to this policy. We recognize the sustained achievement by member states in establishing governance frameworks for research that adhere to international standards. Panama recently assessed its research and innovation policy in health, establishing and implementing its national agenda for research and innovation in health, responding to health needs and requirements. Our system has made important strides, especially to determine priorities and establish partnerships and incentives. However, there are still areas that require more attention, such as evidence integration for decision-making and strengthening human capital. This is still in its early phases. Panama reaffirms its commitment to implement clear strategies for rigorous, continuous, efficient assessment of scientific evidence and to guarantee that this assessment is systematically employed in order to underpin health decisions, to effectively make use of the innovative potential to improve health and well-being of our population. Thank you very much.
Thank you, Panama. I now give the floor to Guatemala.
Muchas gracias.
Thank you, Mr. President. Guatemala takes note of this report. We would like to underscore the importance of the research for health as an essential function of public health. This strategic component enables us to bring down inequalities and to adapt technologies to our context and to strengthen the response to health emergencies. That said, we do recognize that there are still meaningful challenges limiting the full development of this function, among which public research in Latin America and the Caribbean continues to be limited, undermining sustainability of scientific efforts. Furthermore, there are regulatory voids that lead to confusion between ethics and the technical oversight measures. Our ability to retain researchers in technology is hard given brain drain. We do think it's urgent for us to move forward in the following lines of action. First, strengthen national ecosystems for research, taking into account sound ethical frameworks, strengthen technical background and sustainable financing to apply recommendations made by WHO and PAHO to improve the efficacy, transparency, and safety of clinical trials and promote the crafting of a research ethics policy for health, ensuring sound mechanisms of governance to safeguard the scientific integrity, transparency in processes, and the protection of participants in research. 3, to push through high-impact research through regional collaboration and networks of research and emerging technologies like genomics and artificial intelligence and strategies to involve communities. 4, to ensure scientific evidence translate into public policies that are effective through institutional mechanisms which would facilitate the synthesis, evaluation, and the use of information that it generates. Guatemala does believe that science and research should become pillars of our public policies aimed at decisions that will have a tangible impact on the lives of our inhabitants. With the support of WHO and PAHO, we believe that our efforts to strengthen research in health will contribute to lead to greater sustainable health and well-being for our populace.
Thank you, Guatemala. I now give the floor to Belize.
Thank you, Chair. Belize welcomes the Policy on Research for Health final report on the agenda, item 7.7, and thanks the Secretariat for its continued leadership. We fully endorse the emphasis on strengthening governance, capacity, ethics and quality, information use and partnerships, so that research consistently informs equitable health decisions across our region. Belize is determined to translate this vision into concrete national action. In the coming period, we will work to establish and resource a coherent national health research system and policy aligned with our priority health needs, develop a costed national health research agenda and identify sustainable financing mechanisms, and reinforce coordination across government, academia, and partners so that research questions are driven by service delivery, realities, and public health priorities. We respectfully request continued PAHO technical cooperation to help Belize update and operationalize appropriate regulatory and ethical oversight frameworks, ensuring integrity, quality, and timely approvals, while building the skills of investigators, implementers, and policymakers to generate, interpret, and use evidence. Belize also supports the report's call to strengthen regional platforms that enable member states to share data sets, best practices, and evaluation methods, and to collaborate on multi-country implementation research that answers practical policy questions. We see these platforms as essential to reducing duplication, accelerating learning, and advancing equity, especially for small states with limited research capacity. Crucially, We will integrate research and innovation indicators into our national monitoring systems so that evidence is not only produced, but routinely used to improve programs and outcomes. This includes linking research outputs to our Health Sector Strategic Plan 2025-2034 and ensuring that findings feed back into planning, budgeting, and quality improvement cycles at national and subnational levels. In line with the action requested of the Directing Council, Belize supports regional efforts to mobilize sustained investment in national research system, expand PAHO's technical support for country research policies, and embed equity-focused indicators into routine performance measurement. These actions will help us target investments where the burden is greatest and the returns measured in lives improved and protected are highest. Chair, Belize stands ready to do its part. With continued partnership from PAHO and our fellow member states, we will build a pragmatic, ethical, and policy-relevant research ecosystem, one that turns data into decisions and decisions into better health for every community in Belize and across the Americas. Thank you.
Thank you, Belize. Now I will give the floor to two non-state actors in official relations who've requested to make statements under this agenda item. I first give the floor to the International Federation of Medical Students Associations.
My name is Ana Lucia Palomo, and I speak on behalf of the International Federation of Medical Students Associations. Our federation recognizes research for health as a cornerstone to advance equity, quality, and accessibility of healthcare systems. To create meaningful change, research must respond to the needs of populations, especially those most affected by inequities and barriers. As medical students and future health professionals, we stress the importance of policies that integrate social determinants of health, address inequalities, and strengthen national systems so that evidence translates into inclusive and sustainable policies. We commend efforts in the final report and call upon governments to prioritize equity-driven research that includes vulnerable and marginalized populations, strengthen research capacities through investment, collaboration, and fair partnerships, ensure open and transparent access to outcomes, especially in low and middle-income countries, incorporate equity frameworks considering socioeconomic, environmental, and gender determinants, build capacities among healthcare workers and students to foster innovation and accountability. Research for health is not an end in itself, but a tool to build healthier societies. By aligning policies with equity, we generate knowledge, empower communities, reduce disparities, and promote sustainable development in the Americas. Thank you.
Thank you. I now give the floor to Public Service International.
Public Services International strongly supports and welcomes member states and PAHO's efforts to develop evidence-based health policy research to generate ideas that can lead to protecting health and care workers and strengthening health systems. We also call upon member states to prioritize research that addresses the occupational health and safety needs of healthcare workers. Mr. President, we would like to suggest the establishment of comprehensive occupational safety and health observatories specifically designed for health and care workers across our region. PSI has been developing an observatory in Colombia, and we have been trying to expand the initial experience to other countries. These observatories must collect, analyze, and disseminate data on workplace hazards, injuries, illnesses, and deaths among healthcare personnel. The COVID-19 pandemic revealed the inadequate protection of frontline healthcare workers. Occupational safety and health observatories will provide critical evidence to inform protective policies that will help ensure improved workplace safety in all countries in our region. PSI emphasizes the urgent need for enhanced research into women's health, recognizing that women constitute most of the global health workforce and face unique occupational health and safety challenges. Research priorities must include gender-specific occupational hazards, work-life balance impacts, reproductive health concerns, and risks related to workplace exposures and the intersection of professional and personal health risks. PSI advocates for participatory research approaches that include healthcare workers, patients, and communities as partners in research design and implementation, ensuring that research outcomes translate into meaningful improvements in health services and working conditions. Thank you.
Thank you. I now yield the floor to Dr. Garcia-Saiso to respond to the comments.
Thank you, Mr. President, and I would like to start by thanking deeply all of the member states for, of course, their comments and support to this report and the work that has been carried out over 15 years in our region, and particularly those that comment today: Jamaica, France, Paraguay, Brazil, Cuba, Mexico, Dominican Republic, Honduras, Guyana, Trinidad and Tobago, Panama, Guatemala, Belize, and also our two NSAs, International Federation of Medical Students Association and Public Services International. Allow me to switch to Spanish now.
In the comments that we heard expression about the value of the 15 years of work in our region to strengthen the path toward health research as a priority among the essential public health functions, as well as a lynchstone in resilient healthcare systems that are that much stronger. This prioritization, without a doubt, has given us good results, as you have all shared, and we see this in each and every one of the member states. However, it has opened, or gives us opportunity to take stock of those challenges we currently face and the ones to be faced in the future that collectively we are to face and overcome within this collective approach to becoming stronger in the region. There is no doubt that research and science and knowledge generation, the use of evidence for transformation, all have intrinsic value. The challenges we have faced, not just in the last 15 years in which we kicked off this policy, but especially the COVID-19 pandemic, have taught us this, how important it is to step up investments in health research, to strengthen ethical and regulatory frameworks, to ensure that investments made into our governance mechanisms and research itself can be more effective and better focus on the needs of the countries in our region. Research is a cross-cutting priority that in which all the different things that we have proposed for better health in our region come into play. Productive agenda, research, without it, we would not be able to achieve the targets and goals we've set for ourselves. So the commitment from the Secretariat is to forge ahead, continue working hand in hand with each and every one of the member states to build the future of this shared agenda, which, so that thereby doing, we can ultimately achieve greater benefits for everyone in the Americas. Thank you.
Thank you. I now yield the floor to the Assistant Director for her comments.
Thank you, Mr. President, and thank you to all the member states for their comments. I think it's clear we can all agree that we need to generate good data and have research for health to generate policies and evidence. We need good oversight. We need good ethical oversight as well. We need laws. We need sustainable financing. I think what is critical as well is that we need to guide the research agenda for our region so that it is tailored for us. There are a lot of institutions, academia, who are willing to do research, but are we assured that the research is being conducted tailored to our needs, to our priorities, and to the gaps that we have in research for our unique situation in the region of the Americas? We have identified this, and we have relationships with many, research institutions, universities, as collaborating centers. And just a few weeks ago, what we did is we brought the collaborating centers together with our technical teams to highlight what the priorities are for the Americas, what the gaps are, to make sure that the research that they conduct is tailored to our needs, is tailored to identify and deal with the gaps of our unique situation. I want to highlight a point as well that was raised by one of the non-state actors, the need for research in human resources. I think the COVID-19 pandemic highlighted to us so that sometimes we neglect our healthcare workers and we fail to identify the importance and how the effects of what they do affect them mentally in particular. So I think we need to focus more on healthcare workers, and an area that is that generates a lot of discussion in our region is the drain. Particularly from the Caribbean, we have a lot of our healthcare workers going to greener pastures. Why are they doing that? We need to make sure that we cater or we focus our research agenda into areas such as that. PAHO is willing to facilitate that. PAHO is willing to work with you, our member states, in terms of governance, make sure that research is conducted ethically. We hear your cry for further work in this area, and rest assured that PAHO will continue to work with you. Although this is a final report, we will continue our work in terms of health research. Thank you.
Thank you, Assistant Director. I would like to inform the Council that the discussions will be noted in the final report. We now move to Agenda Item 7.8, Progress Reports and Technical Matters. Sub-Item A, Increasing Production Capacity for Essential Medicines and Health Technologies, Progress Report. I would like to bring document CD62/INF/8A to the attention of the Council and invite Ms. Maria Luz Pombo Castro, the Unit Chief of Quality and Regulation of Medicines and Health Technologies at the Department of Innovation, Access to Medicines and Health Technologies of the Pan American Sanitary Bureau, to come to the head table. I now yield the floor to the representative of the Executive Committee to report on this item.
Thank you, Mr. President. Punto 7.
7.8 Progress Reports on Technical Matters. A. Increasing production capacity for essential medicines and health technologies. Progress Report. The Executive Committee was informed that significant progress has been made towards increasing production capacity for essential medicines and health technologies in the region, including progress in areas such as implementation of multi-sectoral policies, development of technical and regulatory capacities, and promotion of strategic partnerships. There have also been advances in promotion and development of innovative technologies and in strengthening of national regulatory systems to facilitate the production of essential medicines and health technologies. In the committee's discussion of the progress report, delegates welcomed the progress being made toward building a regional ecosystem capable of researching, producing, and distributing health technologies. Support was expressed for continued efforts to increase regional innovation and production capacity, improve regional coordination, and strengthen national regulatory systems. Various obstacles in progress were highlighted, including gaps in investment and infrastructure, regulatory bottlenecks, limited technical capacities, dependence on imported inputs, and a lack of robust monitoring and evaluation mechanisms. Support was expressed for the recommendations outlined in the report. It was emphasized that international and regional coordination is needed to transform the recommendations into action, avoid duplication, optimize resources, and ensure that local production will contribute to improved access to health technologies and enhanced self-sufficiency in the region. It was also considered important to expand the use of health technology assessments and strengthen the health technology assessment network of the Americas. Thank you, Mr. President. This concludes my report on this item.
I will yield the floor to Ms. Pombo Castro to present the item.
Señor presidente.
Mr. President, Dr. Seeley Thomas, distinguished delegates and colleagues, it's an honor to submit the progress report on the implementation of the Resolution CD 59 R3 and CD 48 R15, whose ultimate objective is to improve access to essential medicines and health technologies, reducing outside dependence, and to strengthen health resilience in our region through strengthening their productive and innovative capacities. Throughout the last period on which we are reporting, member states have achieved strides in key areas such as coordination and implementation of multi-sectoral policies, the development of technical and regulatory capacities, and the promotion of strategic partnerships. We have also achieved considerable headway in developing policies and programs at the national level to foster innovation and production of health technologies. As a case in point, in Canada, Brazil, Colombia, Mexico, and Cuba, among others. Concrete strategic initiatives have been pushed forward. For example, a vaccine production on different platforms. The regional platform for innovation and production of PAHO promotes, furthermore, the consolidation of a more integrated ecosystem regionally that is coherent and capable of responding as needed to public health needs through strengthening sub-regional, global, South-South cooperation and partnerships. PAHO, with the support of the Government of Canada and other partners, has collaborated actively with WHO and Medicines Patents Pool to strengthen regional productive capacities of messenger RNA vaccines through partnerships with public and private institutions, including concrete commitments for access by member states to said technologies at times of emergency, through the approval of Resolution CD 61 R14 adopted in 2024 by member states. The regional revolving funds of PAHO have additional capabilities to promote innovation and production throughout the region. For example, the agreement reached for PCB 20 in Argentina is a example of cooperation that will allow for the use of this innovative vaccine throughout Latin America at a more affordable level. Also, developing ecosystems for promotion and production. We would like to underscore that more member states are prioritizing strengthening their regulatory systems in order to consolidate stable systems that are integrated and work well, and to reach acknowledgement of their ability regionally and worldwide through the implementation of a single tool for the assessment of these systems and the assessment and determination of institutional development plans, enabling them to reach that goal, that is, of maturing their regulatory framework. Now, the Bureau and regional reference labs in Latin America are currently working together to be redesignated as labs of regional reference, or to transition to those authorities on the WHO list. The report concludes with recommendations to continue supporting investment in research and development to develop ecosystems for innovation and production, including strengthening regulatory systems, consolidating a stable regional demand, and to expand technology transfer projects and to deepen regional integration. Progress covered in this report reflect the collective commitment of our region to strengthening their productive and innovative capacities and access to health technologies. Thank you very much.
Thank you. I now invite the Directing Council to take note of this report and to provide any comments it deems pertinent. I now open the floor to the plenary to begin discussions. Suriname, you have the floor.
Thank you, Mr. Chair. The Ministry of Health, Welfare and Labor of Suriname wishes to express its sincere appreciation to the Pan American Health Organization for the comprehensive process undertaken to prepare the progress report on increasing production capacity for essential medicines and health technologies. We recognize the value of the regional consultations, the evidence gathered, and the clear recommendations provided, which are crucial for guiding our action. For Suriname, this policy and the actions outlined are particularly important. Our country faces challenges of limited domestic production, dependence on imports, and difficulties in ensuring timely and affordable access to essential and high-cost health technologies. We believe that the regional approach promoted by PAHO, strengthening regulatory systems, investing in research and development, promoting technology transfer, and leveraging the revolving funds is essential to help small economies like ours overcome the barriers. Suriname recognizes the work of the PWR Suriname, the health systems and service advisor in advancing this agenda nationally. Moving forward, Suriname looks to PAHO's continued support in 3 areas. 1, strengthening national regulatory capacity so that we can meet international standards and ensure the quality, safety, and efficacy of health technologies. 2, technical cooperation for local adaptation and technology transfer, including opportunities for regional collaboration on vaccine and medicine production. 3, facilitating access to high-cost technologies through pooled procurement, market transparency, and equitable pricing mechanism. We reaffirm our commitment to work with PAHO and member states to ensure that innovation and equitable access to essential medicines and technologies become a reality for all peoples in the Americas. Thank you.
Thank you, Mr. Suriname. I now give the floor to Panama.
Buenos días.
Good morning. Thank you, Mr. President. The Panamanian delegation is pleased to see this report as presented, in which we see regional lines for strengthening research, development, technology transfer, and the production of health technology to improve equitable access to the same. We appreciate the drafting of this report, in which public information of member states was examined, and that of other bodies and important organizations, as well as the results of the consultation that was conducted by the Bureau at the beginning of 2024 within the context of the presentation of the final report of the policy on access and proper use of medicines and health technology that are of high cost. The implementation and practice, however, of this report still faces some obstacles, especially in adapting to specific contexts within the context of regional efforts. And so, depending on activities carried out in different fora and meetings, shows that local production might be held back by structural challenges such as infrastructure, financing, and technical capacity that in each country may be limited. The lack of follow-up and evaluation mechanisms that are rigorous about the effectiveness of this initiative might also limit the real impact in creating sustainable capacities. Panama takes note of this report and asserts its commitment to make sure that these initiatives have a tangible impact on the production distribution of medications in our country, as well as to transform these recommendations into concrete, sustainable action, avoiding a duplication of efforts, optimizing resources such that we can ensure local production and that production actually does improve access to medications and their effectiveness. Thank you.
I now give the floor to the Bahamas.
Mr. President, the Bahamas welcomes the report and acknowledges the clear progress made. We agree that actions to strengthen regional health technology capacities are urgent and necessary. We strongly support the call to build innovative ecosystems through coherent policies, stronger regulation, and investment in human resources. As a small island developing state with limited domestic manufacturing capacity, the Bahamas is acutely aware of the vulnerabilities in global supply chains and the challenges posed by high prices and import dependency. The COVID-19 pandemic underscored the urgency of strengthening regional production and regulatory systems to ensure health security and equity. We see value in leveraging PAHO's revolving funds and pooled procurement to consolidate demand and create stability in regional markets. We note the need for sustainable financing mechanisms and the importance of financing remaining realistic, while balancing innovation with the immediate pressures of service delivery and fiscal constraints faced by smaller health systems. The Bahamas supports the strategic lines of action outlined in the report, particularly the work on strengthening multi-sectoral governance. To support innovation and access, we are exploring opportunities to enhance coordination between our health, science, and industry sectors. The Bahamas is also improving its regulatory systems, and we welcome PAHO's technical cooperation in aligning our regulatory frameworks with international standards. Mr. President, initiatives such as the Innovation and Regional Production Platform and the Help Development Partnership for Africa and the Caribbean encourage regional and international collaboration and offer promising technological transfer and capacity building avenues. The Bahamas views regional cooperation strategies and integration of production value chains as essential, recognizing that these will require overcoming scale, trade, and governance barriers. We recognize the importance of transparency and access to information in guiding evidence-based investment and procurement decisions. We remain committed to working with PAHO and regional partners to improve data systems and support the development of strategic health technologies. We reaffirm our commitment to PAHO's resolutions and regional solidarity in health. We look forward to continued collaboration to ensure innovations reach those most in need. I thank you.
Thank you, Bahamas. I now give the floor to Brazil.
Thank you, Mr. President. Brazil thanks PAHO for these reports, especially the one on increasing the productive capacity of medicines and technologies in health. As I said in the document, our country has been strengthening its industrial and technological policy in health through different structural programs, broadening the national productive capacity, especially for medicines and vaccines, as well as essential technologies. We welcome the efforts made by PAHO to strengthen the networks of collaboration to foster technical cooperation and to support the ANPIC agreement being used more flexible. Now, the Global Coalition for Regional and Local Production for Equitable Access launched by the President of Brazil at the G20 is something else we celebrate, and that within the context of the WHA, and we see that as a key initiative to broaden access and to bring down inequalities. All countries are invited to adhere to that initiative. We also seek to bring down external dependence and to enhance production. Therefore, the launching of the partnership on socially determined diseases within the context of BRICS, which will also have an important innovative component in it. In Mercosur, we are resolved to enhance the productive and innovation capacity with the same commitment of cooperating with countries of our region to strengthen our capacities. Thank you.
Thank you, Brazil. I now give the floor to Costa Rica.
Thank you, Mr. President. Costa Rica thanks the Secretariat for presenting this progress report. We acknowledge the strategic importance of strengthening regional capacity for production of medicines and health technologies, which is crucial to ensure equitable access that is sustainable. We appreciate the multi-sectoral approach that is evidence-based as promoted by the Pan American Health Organization. In the national ambit, we have moved forward in multi-sectoral plans encouraging innovation and improved productive capacity in both public and private sectors, reinforcing our regulatory framework and integrating legislation and intellectual property with a public health approach. We underscore the need for greater transparency in the process for development, acquisition, and distribution of joint technologies. In Central America, the joint Comisca negotiating tool is example worth copying. We'd also like to point out some areas for improvement in the text, lack of impact indicators, and there are no clear metrics about the advances to be able to truly assess concrete results in access or reduction of inequities. For this, we may consider inclusion of the regional indicator framework that would make it possible to monitor progress in production, capacity in medicines and health technologies, an approach limited to innovative medicines. Although there is prioritization and innovation, we also must strengthen public production of essential medicines and state or mixed laboratory models to guarantee strategic supply. There is not much mention of community participation by users. We need to include strategies for citizen participation with public consultation mechanisms as well as health education on technologies. Regional inequality persists. We need to promote specific mechanisms to reduce asymmetries between countries with high and low productivity. Lastly, we must ensure regulatory interoperability to facilitate mutual recognition of health records, transparency in knowledge, cost, and share information. Thank you very much.
Thank you, Costa Rica. I now give the floor to Guyana.
Mr. President, Guyana welcomes the progress report on increasing production capacity for essential medicines and health technologies, and commend PAHO for its leadership in advancing this critical agenda. The COVID-19 pandemic underscores the vulnerabilities of our region to supply chain disruptions and highlighted the urgent need for stronger local and regional production capacity. Guyana recognized the progress made in expanding regional cooperation, fostering technology transfer, and promoting regulatory harmonization. We also acknowledged PAHO's role in strengthening the regional platform on access and innovation for health technologies as an important tool to support member states. At the national level, Guyana continues to face challenges with access, affordability, and timely supply of essential medicines. Limited domestic manufacturing capacity and reliance on external supplies make small states like ours especially vulnerable. In this context, Guyana calls for greater investments in regional manufacturing initiative and public-private partnerships, support for regulatory capacity building, including quality assurance and pharmacovigilance, strengthening regional pooled procurement mechanisms to leverage economy of scales, and enhance technology transfer and research collaboration among member states and partners. Guyana reaffirms its commitment to working with PAHO and regional partners to advance equitable access to medicines and health technologies as a cornerstone of universal health. Thank you.
Thank you, Guyana. I now give the floor to Mexico.
Thank you very much, Mr. President. Mexico received the progress report on increasing production capacity for essential medicines and health technologies with great interest, and we reaffirm our commitment to this strategic objective. In line with our Resolution 3, we recognize that local production, although essential, is not sufficient to respond to the region's needs. Therefore, the Health Secretariat has developed a sectoral roadmap for the modernization of the system, incorporating innovating technologies, seeking efficiency, transparency, and equity. Mexico also promoted a multi-sectoral governance model, working with industry, academia, regulators, and civil society. Any initiative for technological transfer is submitted to a cost-effectiveness assessment, clinical impact, and equity, and evidence-based decisions. We think it is important to reinforce cooperation with networks in the Americas to be able to assess health actions and to make informed decisions. Mexico wants to reinforce regional cooperation with through the sub-regional platforms to harmonize regulatory frameworks, share knowledge, and strengthen local capacities, guaranteeing the sustainability and equitable access to critical technologies. Thank you very much.
Thank you, Mexico. And I give the floor to Honduras.
Thank you very much, President. Honduras expresses its satisfaction with this report about increasing production capacity for essential medicines and health technologies, which recognizes the strategic importance for the region of the Americas to strengthen innovation, multi-sectoral governance, and national regulatory systems to improve equitable access to health technologies. The document updates clearly the advances in multi-sectoral policies, regional coordination, and public-private partnerships, as well as implementation of tools to strengthen pharmaceutical regulation and local production. This is fundamental to reduce external dependence and respond to health emergencies. Furthermore, we appreciate international actions taken and the different mechanisms that facilitate access to innovative medicines. Nonetheless, Honduras suggests having greater clarity and detail about strategies focusing on countries with the transition economy, such as Honduras, to guarantee that the proposed measures do not remain in a general framework, but rather have a specific, sustainable implementation adjusted to national realities. We suggest including explicit promotion of programs for institutional strengthening and specific technical training, facilitating participation of countries with less industrial development, so they may also work in these regional initiatives. It would also be good to have monitoring and evaluation mechanisms with indicators showing advances in those countries with lower productive capacity to ensure that funds and efforts translate into measurable results in countries. This would result in greater regional equity and self-sufficiency in these technologies. Lastly, we're grateful to PAHO for its support to continue reinforcing the regulatory system in our country and expanding access to health technologies of high cost through the regional revolving funds. Thank you very much.
Thank you, Honduras. And I give the floor to Paraguay.
President, delegates, Paraguay notes the progress report presented by PAHO on gender equality and report for 2020-2024. We agree with what PAHO says. The COVID pandemic showed great inequality between the genders, affecting in a disproportionate manner our women, exposing them to the virus, as well as the overload of domestic work, loss of employment, and difficulties in accessing health services and support. We believe that the broken down data are essential to give visibility to inequities and guide effective policies. The region has made strides in the use of gender analysis and intersectoriality to identify inequalities in vaccination programs and sexual and reproductive health programs, incorporating variables such as ethnicity, social class, disability, and migratory situation. This results in a better analysis of gaps and needs of the population. The report offers practical tools that Paraguay deems fundamental to strengthen its health system. The analysis and gathering of disaggregated data by sex, age, ethnicity, and socioeconomic condition makes it possible to adopt informed decisions and design more inclusive policies. Also, the PAHO tools, such as gender analysis and intersectoriality, and the dialogue on knowledge facilitate integration of the gender perspective in programs and health services. Paraguay fully supports the recommendations contained in the report promoting the consolidation of information system, implementation of monitoring mechanisms that are effective, and the adoption of strategies to reinforce equity and equal access to health services. Lastly, my country appreciates the concrete advances described in the report. These are an important contribution to continue strengthening gender equality in health throughout the region. Thank you very much.
Thank you, Paraguay. And now give the floor to Barbados.
Mr. President, Barbados commends PAHO for its comprehensive and forward-looking report on increasing production capacity for essential medicines and health technologies. The report captures both the important progress made in our region and the persistent challenges that continue to limit equitable access. We particularly value its emphasis on innovation, regulatory strengthening, and strategic partnerships, key pillars for achieving health security. Mr. President, the COVID-19 pandemic revealed with stark clarity the vulnerabilities of small and developing states. For Barbados, this underscored the urgent necessity of local production of essential medicines and eventually vaccines. In response, our government has prioritized the establishment of the Barbados Drug Regulatory Authority as a key player of our strategy. The authority will have a broad mandate covering the development, manufacture, importation, storage, distribution, and vigilance of medicines and health technologies. While our basic regulatory framework is in place, we are enhancing it to meet the WHO global benchmarking tool and to realize our vision of Barbados becoming the regional hub for essential medicines and vaccine production. The legislation enshrining the authority is expected to be proclaimed by the end of 2025. This strengthened framework will drive research, development, and technology transfer, deepen regional cooperation through the Caribbean regulatory system, and a single CARICOM marketing authorization window, anchor strategic partnerships with other countries on pharmaceuticals and on fill and finish production, mobilize financing through PAHO and international partners, and build human resource capacity, including specialized training in regulatory systems and pharmacovigilance. Barbados is unwavering in its commitment to a stronger, more self-reliant region. By investing in robust regulation, fostering innovation, and building partnerships, we can reduce dependency, increase resilience, and ensure equitable access to essential medicines and vaccines for all. Thank you.
Thank you, Barbados. I now give the floor to the Dominican Republic.
Thank you, Mr. President. The Dominican Republic has noted the progress report presented and recognized the importance of strengthening national and regional capacities in research, development, technological transfer and production of medicines and essential health technologies. The key elements to improve equitable access in the region of the Americas, our country supports PAHO's efforts to promote innovation ecosystems, regional value chains, and cooperation mechanism to timely access to strategic medicines, consumables, technologies, and especially in the case of health emergency. The Dominican Republic points out that our industry of medical devices has grown significantly in recent years, becoming one of the chief areas of national import. This is an example of how articulation between public and private sector and academia can generate great industrial competitive capacities that in turn can be used in benefit of the regional public health. However, we recognize that there are still significant challenges in this area, such as continue scaling up regional and sub-regional cooperation for technological transfer and production of strategic methods, strengthen regulatory systems through progressive implementation of regional regulatory policy to guarantee the quality, safety, and effectiveness of health products, train more human resources in manufacture with support from PAHO and other international partners. The Dominican Republic reaffirms its commitment to these efforts and requests of PAHO and member states to continue in collaboration to develop shared capacities, allowing us to move forward towards regional health sovereignty, guaranteeing that innovations reach our countries in an equitable manner and may translate in better benefits for our citizenry. Thank you very much.
Thank you, Dominican Republic. I now give the floor to a number of state actors who have requested to make statements under this agenda item. I first give the floor to International Federation of Medical Students Associations.
Honorable Chairperson, distinguished delegates, my name is Marlene Celeste Resendiz on behalf of the International Federation of Medical Students Associations, representing 1.5 million medical students globally. We commend the efforts of member states in addressing inequities in access to essential medicines, diagnostics, and vaccines, while promoting regional resilience and innovation. We envision a future where innovation and production serve the needs of all people. Therefore, we call on member states and international partners to develop a coordinated roadmap based on cooperation and sustainability by strengthening multilateral cooperation to optimize scale, quality, and access, mobilizing sustainable financing, investing in resilient public health-driven production ecosystems, enhancing transparency and data sharing, supporting locally led research and innovation, strengthening public research institutions, and foster partnerships. The COVID-19 pandemic showed us the consequences of inequitable access to medicines. It also showed us that when the world comes together, incredible progress is possible. As medical students, we witness these realities daily in hospitals, classrooms, and communities. Our generation is ready to collaborate on research, advocacy, and innovation, working with governments and institutions to build stronger, fairer, and more resilient systems. We're not only the health force of tomorrow, we're active partners today. It is a matter of justice and the right to health. We urge member states and partners to create a future where access to medicines and health technologies is a guarantee for all. Thank you.
Thank you. I now give the floor to the International Pharmaceutical Students Federation.
Honorable Chair, distinguished delegates, the International Pharmaceutical Students Federation Pan American Regional Office represents over 60,000 pharmacy students and recent graduates across 15 countries in the Americas. PAHO's 2024 report reveals a critical reality: growing shortages of essential medicines across our region. As student pharmacists, we witness daily how these shortages compromise patient care and deepen health inequalities in our communities. Access to essential medicines is a fundamental human right, yet millions across America still face barriers to obtaining basic life-saving medicines. The International Pharmaceutical Students Federation Pan American Regional Office respectfully urges PAHO and the WHO to 1. Strengthen regional essential medicine lists and promote their implementation across all member states. 2. Establish community-level monitoring mechanisms that include pharmacy students in identifying and reporting essential medicine shortages. We stand ready to mobilize our 60,000 members across the Americas to advance universal access to essential medicines. Thank you.
Thank you. I now give the floor to Latin American Federation of the Pharmaceutical Industry.
President, distinguished delegates, FIFARMA, the Latin American IFPMA for Pharmaceutical Industry Investigation and Development. We're grateful for the opportunity to participate and thank PAHO for leadership in this discussion. It's important to look at ecosystems for innovation, responding to local needs and developing also regional values, ensuring more sustainable and rapid access to innovation. Strengthening capacities must be done through manufacture. Investment generates qualified jobs and accelerates access to quality technologies. In some countries of the region, patients wait up to 3 additional years to access innovative therapies compared to other markets, and those with modern regulatory attract 4 times more investment than those that don't have it. Amongst the practices we find regulatory frameworks that are clear, harmonized, predictable, with reliance and quality supervision. Compliance of good manufacturing practices, open competitive markets with transparent public procurement, solid infrastructure for logistics, cold chains, and security, qualified human capital developed in partnership with the private sector, intellectual property for the collaboration and access. In keeping with this, the report on competitiveness and biopharmaceutical investment, BCI, shows that no country in the region has consistent results in all of these pillars. The best performances are where science, regulation, access, and intellectual property move jointly and together. When one of these elements is missing, then the capacity of helping patients is reduced significantly. We reiterate, as always, our commitment to work with PAHO and member states so that the strengthening of capacities can benefit patients, the health systems, innovation ecosystems, and our economies. Thank you very much.
I now give the floor to Public Service International.
Thank you, Mr. Chair. Public Services International is a global union federation representing more than 30 million workers worldwide, nearly 60% from the health sector. PSI welcomes the progress report on increasing production capacity for essential medicines and health technologies. However, we must emphasize fundamental principles that should guide this agenda. Medicines, vaccines, and other health technologies are not commodities. They are an essential component of the human right to health. Their production, distribution, and access must be governed by public health needs, not market logic. While the report highlights various initiatives, PSI is deeply concerned about the over-reliance on public-private partnerships. Experience shows that private sector's involvement often prioritizes profitable markets over public health needs, leading to inequitable access and technology concentration in healthy regions. Public control of pharmaceutical productions is essential to ensure adequate innovation and production priorities, and so health technologies reach those who need them, not just those who can pay. We strongly support the report's emphasis on South-South cooperation. This approach offers genuine alternatives to dependency on multinational corporations in northern markets. However, intellectual property barriers remain a non-addressed issue. Voluntary licensing is just a market-led initiative, not a public health strategy. We need bolder actions. Member states must fully utilize TRIPS flexibilities, including compulsory licensing, to enable local production and ultimately question the usefulness and legitimacy of granting patents on essential health technologies. We call on member states to prioritize public sector pharmaceutical production through public laboratories, reject conditional public-private partnerships that subordinate public health to corporate profits, strengthen South-South technology transfer, focusing on open innovation systems and collaborative approaches, foster cooperation amongst public universities in the region, implement systematic use of TRIPS flexibilities to overcome patent barriers, and picture a world without monopolies on essential health technologies. Market-driven production endangers the lives of health and care workers. Health is a right. Medicines are not a commodity. Thank you, Chair.
Thank you. Before I continue, I just want to remind you that you have allocated 2 minutes to deliver your statement. I now give the floor to the United States Pharmacopeal Convention.
The United States Pharmacopoeia commends PAHO for its leadership in advancing the regional agenda to increase production capacity for essential medicines and health technologies. This progress report underscores both the achievements to date and the critical challenges that remain for countries in Latin America and the Caribbean. USP shares PAHO's commitment to strengthening local and regional production as a pathway to sustainable access to quality-assured medicines. We recognize that advancing this agenda requires not only increased manufacturing capacity, but also regulatory systems to safeguard the quality, safety, and efficacy of medical products. As highlighted in the report, mature and trusted regulatory systems are indispensable for fostering innovation, enabling technology transfer, and ensuring public confidence in locally produced medicines. USP believes that strengthening regulatory capacity and fostering regional production must go hand in hand. Together, these efforts will reduce dependence on imports, mitigate vulnerabilities during health emergencies, and expand equitable access to essential medicines. We remain committed to working with PAHO, member states, and regional partners to build resilient systems that protect and promote the health of all people in the Americas. Thank you.
Thank you. I now give the floor to the World Federation of Societies of Anesthesiologists.
Muy buenos días, distinguidos miembros.
Good morning, distinguished member of the Council. It's an honor to be before you today representing the World Federation of Anesthesiologists, but also being spokesperson for many patients and physicians that face so many health problems in our region. Medical professionals that work without the basic consumables, jeopardizing the life of patients.
Represents over 500,000 anesthesiologists in more than 150 countries, including 23 member societies across the PAHO region. WFSA welcomes the progress report on strengthening regional production capacity for essential medicines and health technologies. Despite policies that recognize their importance, too many life-saving technologies remain unavailable in practice. A striking example is a capnometer. Capnography is a WHO-listed essential monitoring technology and a cornerstone of safety anesthesia, critical care, and emergency medicine. Yet, in many PAHO member states, operating rooms and intensive care units continue to function without access to this basic monitor. The consequences are avoidable harm or recognized esophageal intubation or endotracheal tube displacement, ventilator disconnection leading to preventable deaths. The gap between policy and practice underscores the urgent need for concerted actions. WFSA urges member states to recognize capnography as an essential standard for safety anesthesia in national guidelines, embed capnography and other essential monitors into procurement and supply chain system, ensuring their inclusion on national and global priority medical devices list, eliminate tariffs and taxes that raise the cost of importing life-saving technologies, support local and regional production and distribution of affordable quality-assured monitoring equipment, invest in training to ensure clinicians can use and maintain these technologies effectively, establish accountability mechanisms to track the availability and functionality of essential monitors. Closing the implementation gap for capnography is both a quality and safety imperative. Ensuring universal access to essential monitoring will reduce preventable deaths, strengthen health system resilience, and advance progress towards universal health coverage. Thank you.
Thank you. I now yield the floor to Ms. Pombo Castro to respond to the comments.
Primero que nada, I would like to start by thanking everyone for their comments. That is the 11 countries, member states of PAHO who have spoken, who are clearly stressing the agenda, highlighting the agenda that was raised today in a number of documents of the governing bodies about which we have been talking all week, the important role that partnerships between public and private institutions play, all of which have been recognized by you, the need to promote an exchange among countries and across regions that are working toward a common goal of a greater innovation and production with a focus not only on health technologies, generally speaking, but those that have to do with the health medications and technologies which are essential in health. these are all topics that, one way or another, all have raised here. Now, establishing agreements as a part of investments in innovation is another topic raised by all. But I also take note of some recommendations that have left have essentially asked the Secretariat to address the differentiated approaches when we talk about technical cooperation as it relates to all the different realms addressed here, and to define assessment mechanisms and to gauge the impact that all of these efforts have, showing that they actually are worthwhile and sustainable over time, and shared capacities, to strengthen shared capacities as regards innovation, the harmonization of regulation, or with the skill set that HR has to have, that the human resources have to have in innovation and production. I would like to express thanks to everyone who has spoken today, because it just goes to show that you are collaborating on this agenda of production and harmonization of regulation. That just goes to underscore the effort that we have made across all of the agents at PAHO and elsewhere to underscore and to address health challenges. And lastly, I would like to express thanks for the opportunity to offer the first progress report on the adoption of a policy of innovation and production, and that we hope all of you will continue to support, and that we continue to stress this as a part of our daily activities. Thank you.
Now I'll give the floor to the Assistant Director for her comments.
Thank you, Mr. President. I'd like to join Marilis Pombo in thanking all the member states for their comments. Increasing production capacity for essential medicines and health technologies is a priority for the Pan American Health Organization, and certainly every time Dr. Barbosa speaks, he talks about the importance of this, which was highlighted with the COVID-19 pandemic. Rest assured that we've taken note of your comments and the obstacles and the gaps in fulfilling this mandate, and we will continue to work with member states and tech companies and other relevant stakeholders in making sure that we fulfill the mandate for our member states. Thank you.
Thank you, Assistant Director. I'd like to inform the Council that the discussions will be reflected in the final report. This has brought us to our coffee break, and I want to tell members, colleagues, ministers, that we'll be taking a shortened coffee break. Now we will resume at 11:25. Thank you.
Because, as around the world, cardiovascular diseases are the leading cause of death. But so many of these lives could be saved with better control of hypertension. If we could raise population control from 36 to 50%, we would prevent nearly 440,000 deaths and almost 3 million cardiovascular events. In the Americas, as around the world, cardiovascular diseases are the leading cause of death. But so many of these lives could be saved with better control of hypertension. If we could raise population control from 36 to 50%, we would prevent nearly 440,000 deaths and almost 3 million cardiovascular events. From the global vision of the World Health Organization came HEARTS. The Pan American Health Organization, with leadership from the Ministries of Health of the region, expanded that vision into HEARTS in the Americas, a strategy for quality improvement. Today, 33 countries are committed. More than 9,900 health centers are implementing HEARTS, reaching 42 million adults. We are transforming primary health care with the HEARTS clinical pathway, promoting team-based care and the use of data for continuous cycles of improvement. In 2025, over 6.3 million adults are receiving treatment, and more than half already have their blood pressure under control. But our story is still being written. Over 200 million adults in the Americas live with hypertension. And our goal is clear, that everyone has access to better care. This is Hearts in the Americas.
Los casos de sífilis están en aumento en América Latina y el Caribe, con un aumento del 30% entre los adultos de 15 a 49 años. Esta enfermedad afecta a personas de todas nuestras comunidades y se propaga rápidamente, pero tenemos el poder de detenerla. La sífilis congénita representa una amenaza seria para los recién nacidos, pero podemos prevenirla. Ahora es el momento de actuar. Las pruebas integradas y el tratamiento oportuno son esenciales para proteger a nuestras comunidades. Para más información, visita paho.org.
Aging opens up a world of possibility. The possibility of continuing to do what we love and be who we are. But without the right support, aging can also bring limitations. Poor health, vulnerability, loneliness. We believe that a safe, caring, and supportive environment can turn aging into an opportunity to be healthy, to live fully, to embrace change, and keep learning and developing. We believe all people have the right to thrive at any age. Adding dignity to years, well-being to years, life to years. It's the decade of healthy aging in the Americas, adding life to years.
representatives from 18 nations at the Assembly Hall of the Academy of Medical, Physical, and Natural Sciences, now known as the Carlos J. Finlay Historical Museum of Science. This code, later ratified by all countries in the Americas, defined the duties of the Pan American Sanitary Bureau, today known as the Pan American Health Organization, PAHO. It established clear responsibilities for countries to report disease outbreaks, standardize prevention and control efforts, and gather crucial health data. This collaborative approach, rooted in the values of Pan-Americanism, recognized that health cooperation was essential, not only for the well-being of each country, but for fostering safe international trade across borders. Even today, a century later, the Pan American Sanitary Code remains a guiding force, continuing to shape PAHO's mission to promote the health and well-being of individuals, families, and communities across the Americas.
I think in the foreseeable future, we can envision a malaria-free Amazon.
We can change the life of many people by reaching this elimination goal.
Yo me llamo Daniela Gómez, me dedico a pintar, ilustrar y hacer murales también, pinturas en formatos grandes sobre nuestro entorno, con nuestra cultura. Me gusta mucho pintar.
Está muy bonito y muy alusivo a lo que en estos momentos está pasando con lo de la fiebre amarilla.
Estamos en el municipio de Ataco, un municipio que queda al sur del departamento del Tolima, hace parte del Foco Sur. Es uno de los municipios que tiene un número importante de casos y una letalidad bastante alta, es decir, tenemos 9 muertos como producto de la fiebre amarilla.
Entonces nosotros queremos, mediante el arte, poder llegar a la gente y poder invitarlos a que lo vean como algo amable, que se dejen de lado los mitos de que es algo malo, y pues
Honorable Ministers, delegates, let us resume. We are at item 7.8, sub-item progress reports on technical matters, sub-item B, PAHO Gender Equality Policy, and a progress report. I would like to bring document CD62/INF/8B to the attention of the Council and invite Dr. Harry Eggman, Director of the Department of Social and Environmental Determinants for Health Equity of the Pan American Sanitary Bureau, to come to the head.
The period that was covered in this period, in this report, was heavily influenced by the COVID-19 pandemic. And as women make up the majority of the healthcare workforce, they faced greater exposure to the virus. They experienced increased job losses, increased workload at home, and challenges in balancing caregiving responsibility with their professional lives. Additionally, social isolation intensified domestic violence, and restricted access to support and health services further impacted women's physical and mental health. Still, some progress was made during the period 2020 to 2024. Member states, with the support of the Pan American Sanitary Bureau, have continued to work to strengthen capacities to implement policies to improve the health of women, including measures in the health sector to combat domestic violence. The evidence base was strengthened to improved monitoring systems. Tools to assess gender gaps were developed and applied. Capacities were built, and diverse women's organizations were more involved in health planning and implementation. However, much remains to be done. The report also presents recommendations for countries to improve the health of women and men and to advance gender equality and health equity. These are recommendations, which are in line with the mentioned evaluation of the integration of gender equality in PAHO's technical cooperation in health in the Americas, include to better integrate a gender equality approach in health policies, to improve data systems to better collect and analyze disaggregated data by sex, to inform policy and decision making, to establish robust monitoring and accountability frameworks with social participation to institutionalize gender equality in the health sector, to engage women's groups and civil society, especially those representing populations in situations of vulnerability, in the shaping and the monitoring of health policies, and to foster intersectoral coordination, for which we have talked a lot over the last few days. The Secretariat remains committed to supporting the implementation of this important agenda. Thank you, Mr. President.
Thank you, Dr. Agnes. I now invite the Directing Council to take note of this report and to provide any comments it deems pertinent. I now open the floor to the plenary to begin discussion. Uruguay, you have the floor.
Muchas gracias, señor presidente. Thank you, Mr. Chair. And I thank you for the report on PAHO policy on gender equity, which clearly demonstrates how the pandemic of COVID increased inequality and highlighted the impact this had on women. We also are positive about that the challenges and lessons learned open up the opportunity for the adoption of pending measures strengthening women and increase their contribution. Mr. Chairman, in further developing the capacity for the creation of gender-based data is fundamental not only to generate evidence, but in order to adopt effective measures that respond to the need and unique particularities of all. It is also fundamental in order to be able to make decisions in the area of health that is informed and based on scientific access to quality of reproductive health services is a human right. In addition to having a solid framework, our country has taken on the commitment of working actively to battle the scourge of gender-based violence through developing teams that respond to this in the integrated national health system. We've also implemented specific measures to increase voluntary interruption of pregnancy by fulfilling the standing rules and eliminating barriers that make it difficult to access this right. We also have worked towards improving training of healthcare workers, and we will provide continuing education to healthcare workers in the area of reproductive rights to ensure integrated, respectful, and life-based evidence. We know that by including gender perspectives in public policies saves lives and reduces maternal mortality. We encourage PAHO to continue working with our member states to include the gender equity in planning, following, and implementing healthcare policies, and in assessing the activities and programs of the organization. Thank you.
Now give the floor to Suriname.
Thank you, Mr. Chair. All measurements of the report are relevant to Suriname. Under the government commitment to various international agreements, including the CEDAW, CRC, Beijing, POA, and the SDGs, substantial progress has been achieved in the strengthening of the legal and policy framework, to mention some. Various adaptation in moral code to strengthen protection for women and children against sexual violence and abuse. Equal Treatment Labor Act 2022 prohibits workplace discrimination. Violence and Sexual Harassment in the Workplace Act 2022 protects workers. New Civil Code 2025 ensures equal guardianship rights for men and women. Ratification of ILO Conventions on Equal Treatment, Social Security, and Maternity Protection, effective November of this year. Gender Vision Policy 2021-2035. National Policy on Sexual Reproductive Health and Rights. National Strategy on Maternal and Newborn Health. National Strategy on Adolescent Health 2023-2030. Implementation of the digitalization through the Perinatal Health Information System, SIP+, for monitoring and evidence decision to improve maternal and newborn health response. Capacity building of health workers to strengthen the health sector response to violence against women and children. Establishment of the National Council on Domestic Violence. Although significant improvements have been achieved in the area of legislation policy development, Suriname still ranks high in the region with respect to maternal and neonatal mortality. Therefore, we request PAHO for continuing its technical support to decrease this number. I thank you, Mr. Chair.
Thank you, Suriname. I now give the floor to Cuba.
Muchas gracias, señor presidente.
Thank you very much, Mr. Chairman. In our country, we've made significant progress in the area of equality, particularly gender equality. However, the challenges are many, because to really change equality, both within and outside the process, we need to build the patriarchal paradigms of humanity and eliminate them because they've been structured throughout life. We must adopt the Convention on the Elimination of All Forms of Discrimination Against Women, CEDAW, and the adoption of policy approved in 2019 and the national program adopted by presidential decree amongst other legal documents. During the 2024-25 period, the presence of women who have seats in the Cuban parliament increased to 56.7%. There's significant progress of women's presence in this national body over time is evidence if realized in 1981, men held 77% of the seats and women only 23%. But close to 51,000 women in Cuba are involved in science and technology, which represents the highest numbers in the last few years, according to the National Information Statistics Office. These examples reflect the political will of the Cuban government in the area of gender and equality.
Thank you, Cuba. I now give the floor to Honduras.
Muchas gracias, señor presidente.
Thank you, Mr. Chairman. Honduras acknowledges the importance of the progress report on PAHO policy on gender equity and values this as a strategic instrument to achieve this regionally and provide more inclusive and equitable health. One of our strategic objectives has been to strengthen governance in the public health systems by encouraging plans and policies that are gender-focused. Our national plan for restructuring health 2024-2030 includes the gender perspective as a cross-cutting axis to promote greater access in access, quality, and service coverage. Likewise, the assessment of the gender focus in the technical cooperation of PAHO and national policies. Between 2020 and 2024, in the midst of the pandemic, we saw a relevant increase in integrating this policy in the national response through information systems and major training systems by virtual means. We also promoted the participation of women's organizations and indigenous organizations in health initiatives. Honduras believes that a major achievement is that 21 member states now include the sex variable in their administrative systems, and 11 include ethnic self-identification, strengthening the evidence-based basis for having more effective decisions. Honduras reaffirms its commitment to moving towards comprehensive integration of strategies and sustainable financial structures so that we have proper guidelines to following and continuing our gender-based activities in the health sector. We also suggest that we establish a national tracking system that assesses the advancement of each country, promotes greater transparency, and supports converting policies into concrete actions that reduce structural inequalities. Thank you.
Thank you, Honduras. I now give the floor to Guyana.
Mr. Chairman, Guyana thanks the Director for the progress report on gender equality policy and commend PAHO for sustained commitment to advancing gender equality and equity in health across the region. We recognize the importance of achievements made in the mainstreaming gender into health programs, strengthening data disaggregation, and promoting equity and access to services. The report clearly demonstrates that progress has been made, but also reminds us that persistent gender gaps continue to impact health outcomes, particularly among women, girls, and vulnerable population. Guyana has prioritized gender mainstreaming in health policies and programs, with a strong focus on expanding access to sexual and reproductive rights health services, reducing maternal mortality and gender-based violence, ensuring equity in health access for women and girls in hinterland and indigenous communities. We acknowledge the challenge of limited resources, cultural barriers, and data gaps, which hinder full implementation. Therefore, Guyana calls on PAHO to continue technical cooperation from PAHO to strengthen gender-sensitive health policies, support for capacity building to integrate gender analysis across health programs, and greater investment in data systems to monitor inequities and measure progress. And lastly, regional knowledge sharing platforms to highlight best practices in advancing gender equality. Guyana reaffirms its commitment to the gender equity policy and will continue working with PAHO and regional partners to ensure that health systems are inclusive, equitable, and responsive to the needs for all. Thank you.
Thank you, Guyana. I now give the floor to the Dominican Republic.
Gracias, señor.
Thank you, Mr. Chairman. The Dominican Republic would like to thank you for this report on progress on gender policy. And this constitutes an essential instrument in order to continue with the development of efforts aimed at promoting equity, inclusion, and equal opportunity in health systems under the PAHO gender equality policy. This report stresses the progress reached as well as challenges still focused by including and integrating this in all programs and public health actions. Our country believes that gender equality is a fundamental right in order to ensure the right to health to all persons. The implementation of this policy reinforces national efforts aimed at eliminating gender gaps and to promote the full participation by women. These efforts are framed within our national policy of cross-cutting issues on gender that was conceived in the National Development Strategy 2030, which currently is part of the policies assessed as a part of the performance of a public activity. This national policy of cross-cutting integration establishes clear guidelines so that implementation and assessment of public health programs will consider in a systematic way the gender differences. Likewise, it promotes the development of evidence disaggregated by age and sex, strengthening our capacity to design inclusive, effective interventions, as well as the integration of the approach in order to ensure that women, children, and men will be approached in an integrated and equitable fashion. In conclusion, the Dominican Republic reaffirms its commitment with the promotion of gender equality in health by fully supporting the policy on this score and promoting its implementation in an effective way at a national level. We are convinced that the integration of a gender approach in a cross-cutting manner in all health actions will enable us to build a more inclusive, equitable, and sustainable systems, ensuring that each person will not be left behind within access to health services of quality, timely, and with equal opportunities. Thank you.
Thank you, Dominican Republic. I now give the floor to Brazil.
Obrigada, senhor.
Thank you very much, Mr. Chairman. Brazil takes note of this report on PAHO Gender Equality Policy, its progress report, acknowledging the efforts of the organizations in promoting equality and thus facing inequities in the region. In Brazil, maternal mortality among Black women is almost the double than what is observed with white women, and this disparity mobilized the Ministry of Health in order to strengthen the line in an intersectoral line promoted by President Lula in order to repair the inadequate service provided to Brazilian women to ensure timely responses and to promote racial equality in maternal health. That progress depends on the disaggregation of data by gender, sex, as well as social participation in the formulation and orientation of public policies. Priority actions undertaken in the management of Minister Alexandre Padilla. The Ministry of Health has undertaken important actions in providing care to women in violence by giving preferential treatment and measures of prevention of diseases and sexually transmitted diseases and undesired pregnancy. Amongst health workers, most of them are women and Black persons. So, however, the positions are occupied in their majority by men and people that are not Black. Brazil reaffirms its commitment with a comprehensive and intersectoral approach in order to deal with gender violence and to build health systems that are universal, equitable, and sensitive to the intersectionality of race and gender. This performance is an inseparable part of the decision made by the administration of President Lula of not leaving anyone behind. Thank you very much.
Thank you, Brazil. Now I give the floor to a number of non-state actors who have requested to make brief statements on this agenda item. I give the floor to the Coalition for America's Health.
Honorable Chair, distinguished delegates, CLASS, Coalition for America's Health, NCD Alliance, and INWAT, the International Network of Women Against Tobacco, welcome the Progress Report on Gender Equity 2020-2024 as a key input and a roadmap to accelerate commitments to gender equity in health in the region of the Americas. The report shows both progress, such as greater availability of disaggregated data, tools to mainstream gender in health programs, and experiences of participation by women's organizations, as well as persistent challenges, among them the lack of sufficient data, the weak institutionalization of accountability mechanisms, and the reduction of space for civil society. We welcome that the 2025 UN Political Declaration on NCDs and mental health has recognized the need to mainstream the gender perspective and the fundamental role of women, who make up 70% of the health workforce and face structural health problems to which systems have not provided an adequate response. We call on member states to implement PAHO's and World Health Organization recommendations, integrate gender and intersectoriality in all policies, especially in tobacco and alcohol control, and in the promotion of healthy diets, strengthen information systems, consolidate accountability, expand the participation of women in situations of vulnerability, and reinforce intersectoral coordination. GLASS, NCD Alliance, and INWAT reiterate their commitment to accompany these processes to achieve more equitable and just health systems. Thank you.
Thank you. I now give the floor to the International Federation of Medical Students Associations.
Honorable Presidencia y
Distinguished Chairman and distinguished delegations, my name is Melanie Velasco, in representation of the International Federation of Associations of Medical Students. We wish to address our recognition to PAHO and to all member states for the effort deployed in having a gender policy on equality. We acknowledge the progress made in the inclusion of the gender perspective and in the institutional strengthening. However, we still see significant gaps that persist with its implementation, sustainability, and allocation of resources. To attaining gender equality demands going from commitment to transforming actions that will eliminate the structural barriers and will promote inclusion. At the same time, it is essential to deal with the movement of anti-gender activities in the region that not only make the progress slower, but they threaten with reverting the achievements reached. To protect the health systems and policies when dealing with these backlogs is essential in order to protect human rights and to ensure equitable access to health. Thus, we urge all member states to transform the political commitments into sustainable investments with sufficient resources to ensure inclusive and safe participation of our youth, civil society, and vulnerable communities. To follow intersectional approaches that will strengthen the leadership by women and diverse persons at all levels of the health sector, to promote intersectoral cooperation as well as international cooperation in order to integrate gender policies into public policies and to protect the progress made when faced with misinformation and movements that attempt to limit these rights. In a region where inequality continues to be a central barrier to health, to promote gender equality is not only a political priority, but also a moral imperative. We have to take a look at the next generation of medical students, and thus we reaffirm our commitment to work hand in hand with PAHO and member states in compliance with this common objective. Thank you very much.
You will now give the floor to the International Pharmaceutical Students Federation.
Thank you. Honorable Chair, distinguished delegates, the International Pharmaceutical Students Federation Pan American Regional Office represents over 60,000 pharmacy students and recent graduates across 15 countries in the Americas. As youth leaders in health, we commend the Pan American Health Organization for its continued commitment to advancing the gender equity policy. We recognize the progress outlined in the 2020 to 2024 report, including strengthened data collection efforts, capacity building initiatives, and increased dialogue on women's leadership in health. However, we also note persistent challenges, limited disaggregated data, underutilization of intersectional analysis, insufficient engagement in civil society, and barriers to equitable leadership communities and opportunities for women, marginalized communities, and youth. IPSF-PARO believes that youth must be recognized as critical partners in addressing these gaps. Our values of equity, solidarity, advocacy, empowerment, and youth leadership guide the following recommendations. 1. Youth-led data fellowship. Engage pharmacy students in generating gender and equity-focused analyses of existing health data to strengthen evidence-informed policymaking at national and regional levels. 2. Dialogue platforms for women's health equity. Institutionalize regional youth-led forums with Indigenous, Afro-descent, and marginalized women's groups with community partners to co-create culturally safe and inclusive health campaigns. 3. Youth representation and governance. Ensure that young people, particularly young women in health professions, are included in national and regional decision-making bodies on gender and health, recognizing them both as contributors and as a key target group for policies on mental health, reproductive health, and gender-based violence. Solidarity campaigns at the community level is 4. Mobilize youth-led health education initiatives addressing gender-based barriers in immunization, sexual and reproductive health, and prevention of gender-based violence. Youth must not only be consulted by empowering, but empowered to lead, ensuring policies and actions achieve true equity across our regions. Though these actions, IPSF-PARO reaffirms its commitment to supporting PAHO and member states in building gender transformation health systems led by and for youth. We stand ready to collaborate with governments, civil society, regional organizations to ensure that next generation of health professionals lead with equity and inclusion at its core. Thank you.
I now give the floor to Public Services International.
Señor Presidente, delegado.
Mr. Chairman, distinguished delegates, Public Services acknowledges the progress attained in the integration of gender perspectives and policies in health policies. However, health workers, the women that support these systems every day, are faced in a disproportionate manner to harassment, violence, and the difficulties in order to move forward in their careers and the double or triple shift. Therefore, PAHO and member states should establish the necessary measures for the correct implementation of gender policies. The achievements during the response to the COVID-19 ought to be translated into sustainable political frameworks supported by solid, sound data and clear processes so that the decision-making will be effective. We support the recommendation of formalizing gender equality as a cross-cutting issue with clear mechanisms for accountability that will include specific terms and measurable objectives and well-designated policies for its implementation stage. We ask that mandatory assessments be done before and after their implementation in gender policies, providing special attention to intersectional vulnerability that affects health workers that now constitutes most of the staff. The integration of intersectional approaches is essential in order to deal with inequality. Health policies ought to be considered systematically as race, ethnic origin, disability, economic situation, migratory situation, and other factors that worsen discrimination because of gender issues to which they are all exposed. To beef up health systems in order to recover disaggregated data and to train health teams in analysis and intersectional information. It is essential to reinforce intersectoral information among all institutions, gender, labor, judicial, and our organization asks that interministerial committees, formal committees, be created with measurable results and joint financing mechanisms. We want member states to actively include trade unions and social movements to take advantage of their capacity to supervise these gender issues, psychosocial matters, hygiene, and health policies, and to ensure with that the voices of the labor force and the workforce in health, and mostly women, be essential for the development and the implementation of gender policies in the sector. Thank you.
Thank you. Before I go on, I remind you, you are allocated 2 minutes for your statements. I now give the floor to World Heart Federation.
Honorable Chair, distinguished delegates, the World Heart Federation welcomes the progress report on PAHO's gender equality policy. We applaud WHO and member states for their continued commitment in advancing equity in health. Despite progress, inequities persist for women, including heart health. CVD remains the leading cause of death in women across the Americas and worldwide, responsible for nearly 35% of deaths each year. Yet, women continue to be underdiagnosed, undertreated, and underrepresented as patients, healthcare professionals, and public health leaders. The underrepresentation in practice, research, and leadership contributes to treatment gaps, misaligned policies, and limited integration of gender-sensitive perspective in care. Advancing women's participation and leadership across health systems is essential to achieving equity and quality of care. WHF urges member states to integrate gender equality into national health policies, strategies, and regulatory frameworks supported by institutional mechanisms and dedicated structures, promote equitable representation and leadership of women across the health sector through policies and capacity building initiatives, ensure that CVD is clearly addressed as part of gender and health equity initiatives with women's specific needs embedded in PAHO's forthcoming strategic plan 2026-2031. Strengthen the evidence base in gender and health through systematic collection, analysis, and use of sex and gender disaggregated data to inform the design, implementation, monitoring, and evaluation of research, policies, and programs to address women's needs, and support the recruitment, retention, and advancement of women in health and public health professionals to ensure gender-sensitive care, improve professional parity, and raise quality of care. WHF remains supporting WHO and member states to advance gender equity in health across the region to achieving the Sustainable Development Goals. Thank you.
Thank you. I give the floor to the World Organization of Family Doctors.
Señor Presidente,
Mr. Chairman, distinguished Director, distinguished colleagues, on behalf of WONCA, the World Association of Family Medicine Colleges and Associations that represents over 150,000 physicians, family physicians in the Americas, I would like to express my gratitude for this report, as well as the possibility of participating in this meeting and having been granted the floor. Our global association has a committee on equity that is involved in ensuring equitable participation of women in the fields of management and governance of the organization. Besides, we have a strong female leadership because our organization is essentially made up by women. It is with great pride that I can say that the World Association of Family Medicine, as well as the Ibero-American Association, are currently chaired by women, and they're not the first ones in occupying that position. But aside from that, we work with the women that are victims of violence, a serious public health problem in our population. As a result of this, we've consolidated a working group in Ibero-Americas of family physicians, women family physicians that deals with the problems faced by women in the health sector and the health of women. We've already organized 2 academic events in the months of November in order to deal essentially with the problem of violence. We know of the high rates of femicides that impact especially our region, but also we must take a look at the structure of our health institutions, educational institutions that provide services, and even institutions of professional organizations that continue to be profoundly patriarchal. And that brings with it implicitly a quota of violence that we must eradicate. From WONCA, from our organization, we make available our network, our capacities, the work we do in connection with the community and with women in order to continue delving deep into the gender perspective. Please allow me to mention specifically research on this issue as well as in others. It is necessary to continue moving forward on gender equality. It is necessary to step up research in the hands of women. It is necessary to deepen the allocation of funds and the identification of women researchers among women, and especially among women in the migratory populations of Afro-descendants, indigenous, and rural populations. Thank you.
Thank you. I now give the floor to Dr. Eijkmans to respond to the comments.
Thank you so very much for the 8 countries that have intervened and the 6 non-state actors, not only to show the advances that we've made, but also for making concrete recommendations and requests on how do we need to move forward. A couple of things I want to highlight. We hear from everyone the importance to have strong data, to know what's happening, to have this evidence so that this can inform our policy setting, our policy making, to ensure that gender is integrated fully into all our policies, to make them effective and to make sure also that they are monitored so that we see what is really happening, how are we advancing. Also, I hear a strong call for acting on those barriers, those persistent, systematic barriers to access to health services, and there, of course, including services related to sexual reproductive health, services that ensure that no woman dies because she's becoming a mother, maternal mortality being one of our biggest challenges and injustices, but also the access to health, that we really need to look and talk about the social determinants of health that you have been mentioning. It is intersection between the different intersectoral actions like labor policies, like social protection, particularly taking into account that women do not only participate, of course, in their labor activities, but also the care economy, which is a huge issue we need to look at on how the double or the triple burden that women have does impact their health and how we can work on that. But also important to highlight this intersection between gender, ethnicity, and socioeconomic position as some of those important determinants, structural determinants of health. We also hear a strong call for continuous participation, effective participation of communities, of civil societies, particularly, of course, of women groups in situation of vulnerability, and also of the youth. The decisive action that we're hearing from almost everyone on the violence against women, unacceptable and still very present in this region, is also very important to hear, and we stay committed to work with you on that. And even, what's been mentioned, the violence against women that happens in our own sector, in the health sector, this is something we need to also put a particular lens on. The evaluation that has just been finalized, and thank you, Canada, for allowing us to carrying out this gender evaluation, how PAHO has integrated gender into its work, is leading the way, together with this policy, in the work into the future, integrating health equity, including gender equality into the work, into everything we do. That's also something we are very proud of, that this is happening and that we are going to work together on that. Now, just as a last comment, I think I couldn't say it better, as our students have said it. We have a moral imperative to act on this, but not only. Also, if we do not include gender equality and health equity in all our policies will not be as effective as they could be. We still leave people behind. We still don't reach everyone that needs to be reached. So it's the moral imperative, but also essential for the effectiveness of our policies. Thank you so very much for all your comments, and I'm sure together we can work and keep working on this region to make it more fair, more just, more healthy, of course, and also more equitable. Thank you very much.
Thank you. Director, do you have any comments?
Yes, thank you, Mr. President. Primeiro gostaria de agradecer.
First of of all, I'd like to thank our member countries for their comments, as well as non-state actors on this point that is so important. This is a progress report, and undoubtedly, at the same time that it does highlight some important progress that was made in the region by many countries that have already had technical cooperation and support by PAHO to include the prospect of gender equality in the development and implementation of public health policies. We still have a long way to go. I would like, with Ms. Eichmann, I believe that she made a very broad comment here, and I'd like to stress 2 or 3 points that she raised. First, the importance of disaggregated data. If we do not have disaggregated data, then we don't have the possibility of identifying who is lagging behind. If we only continue using averages or mean values, we will always have policies that work for some, but they don't work for everybody. If we don't have disaggregated data, then we're not able to identify the barriers to access that make it almost impossible for the health policy, whatever this may be, will have the success that is expected. So the issue of disaggregated data for gender equality is important, but also in dealing with the issues of inequity that we have for Afro-descendants in the region and for indigenous people. These are important issues, and if we do not have the information, we will not have effective policies to act on. The issue of the problems that we face in the region are problems that have been discussed on various items here during this meeting. It draws our attention, and this was underscored by several of you, the issue of violence against women, where the health sector has a very important role to play, because the preparation and the training of community health professionals, primary health professionals, in emergency rooms, all professionals can play an important role in order to protect the victim, in order to offer the necessary care and support, and at the same time establish the connection with law enforcement and justice services so that this violence will not end up in the death of women many a times that unfortunately shows numbers that are not acceptable in our region. But this is also reflected in the level of pregnancy amongst adolescents. It is a key indicator that in many countries and in many areas in our region, adolescents do not have access to information and to the necessary means in order to avoid pregnancy, which is an additional burden of difficulties in their personal life, the life of their families, and the life of their communities. In maternal mortality data that we still have, if we compare this with other regions in the world, we will be able to see that we're doing better, but by no means are we to believe that this is as far as we can go, because we already have the tools, we have the technologies, we know how to transform maternal mortality and to turn this into a problem that will no longer exist in the region. So we have a long way to go on that, as well as the elimination of cervical cancer. Still, 44,000 women die every year in the region. A death caused by a disease that could already be almost completely eliminated in the region. So it seems to me that these are important aspects of the health situation that we have to deal with in the region. I also wish to draw your attention for the need of having a cross-cutting approach that has already been mentioned here, and to review in each one of the policies whether the policy is taking into account the real difficulties in access. Many women, as we know in Latin America and the Caribbean, half of the families, the poorest families in the region, only have one adult that has an income, and that adult is a woman. So this is a woman that many a times also works in the informal economy without the social protection, formal social protection network. They have to look after their family, to have many tasks to perform, and many a times are responsible for providing care to an older adult that is their responsibility. And it is a situation that, if not taken into account in each one of the policies that we develop and implement in the countries, we will not be able to continue moving forward. I'd like to thank Canada. Aside from being a member state through GACI, Canada is a significant partner in dealing with the gender equality in the region. I also wish to thank Spain that also cooperates in dealing with this issue. It seems to me that these are quite significant contributions that are facilitating the fact that PAHO can provide support in each one of the countries, and that in this period of time that we still have with this policy, that we will continue moving forward for the benefit of other countries, so that at the end of this term, we will have all countries in the region with a gender equality policy that has been incorporated as an essential axis of their national health policy. Thank you very much.
Thank you, Dr. Barbosa. And I would like to inform the Council that the discussions will be reflected in the final report. Now we will start sub-item C, Cooperation for Health Development in the Americas, the progress report. I would like to bring document CD 62/INF/8C to the attention of the Council and invite Ms. Piedad Huerta, head of the Country and Sub-Regional Coordination Office of the Pan-American Sanitary Bureau, to come to the head table. I yield the floor to the representative of the Executive Committee to report on the item.
Thank you, Mr. President. Item 7.8, Progress Report on Technical Matters. C, Cooperation for Health Development in the Americas, Progress Report. The Executive Committee was informed that the Bureau's effort to strengthen cooperation for health development in the region have included promoting inter-country cooperation and advancing health diplomacy in international forums, such as the G20, the United Nations General Assembly. The Bureau has also strengthened the exchange of knowledge and best practices, and under the PAHO Forward Initiative, has developed tools and platforms to increase the visibility and technical cooperation achievements. In the committee's discussion of the report, delegates welcomed the progress made and applauded the Bureau's efforts to promote South-South and triangular cooperation. Delegates also welcomed the efforts to raise the profile of the region through participation in forums such as the G20 Summit and enhance cooperation with sub-regional integration mechanisms. The Bureau also was encouraged to actively pursue further collaboration to optimize resources and results and to foster opportunities for greater cooperation between state and non-state actors. Cooperation between countries was highlighted as a means of providing targeted response to regional health challenges and fostering innovative solutions and resources. The Bureau was requested to include more outcome-level indicators and impact assessments in future reports to strengthen the evidence base for such cooperation. Thank you, Mr. President. This concludes my report.
Thank you, Minister. I now give the floor to Ms. Huerta to present the item.
Muchas gracias. Muy buenas tardes.
Thank you. Good afternoon. This is the 5th progress report drafted since the adoption of the Policy of Cooperation for Health Development in the Americas in 2013. Since then, PAHO has promoted cooperation amongst countries, and health has been positioned as a priority in international political spaces of high level, such as at the G20 and at the UN, amongst others, in order to keep active cooperation with sub-regional international organizations. The organization also participates in the Interagency South-South Cooperation Group of the United Nations, and its role has been highlighted in initiatives to prepare for epidemics and in the transfer of technology for the production of vaccines. as reflected in the report of the Secretary General on the state of South-South cooperation. Likewise, PAHO has promoted the exchange of experiences and successful practices through South-South cooperation projects, as well as triangular projects in different areas. During the 2023-25 period, 17 cooperation projects were financed for health development using its own resources, and we have also captured additional funds, particularly through the India UN Fund. We have also established interregional partnerships, such as those we have established with the Africa CDC and the Embryo region. The objective has been, of course, to increase the access to medication and health technologies. The relevance of this modality is highlighted in the resolution adopted in 2024 at the UN General Assembly. And it's important to recognize the importance of South-South and triangular cooperation as a fundamental tool to undertake joint action either between countries or between sub-regional integration mechanisms. In PAHO, we would like to appeal to member states to continuing pushing for this kind of cooperation, which allows us to have an exchange of successful experiences or about ways of work, technology, methodologies, and it's a way based on the principles of solidarity to help one another. Thank you very much.
I now invite the Directing Council to take note of this report and provide any comments it deems pertinent. I now open the floor to the plenary to begin the discussions. Canada, you have the floor.
Thank you, Mr. President, and I will make a very short intervention regarding given time to indicate that Canada appreciates PAHO's continued leadership in this area and commends the comprehensive nature of this progress report. We support PAHO to continue pursuing collaboration with sub-regional integration bodies to optimize resources and results, and to continue strengthening the evidence base for inter-country cooperation by including more outcome-level indicators and impact assessments in future reports. Finally, as shown by our financial contribution towards the development of the PAHO regional platform to advance the manufacturing of COVID-19 vaccines and other health technologies in the Americas, Canada continues to advocate for the potentials of regional cooperation as a useful programming tool for targeted responses to regional health challenges by fostering innovative solutions and resources in the Americas. Thank you.
Thank you, Canada. I give the floor to Panama.
Gracias, señor presidente. La delegación.
Thank you, Mr. Chairman. The delegation of Panama would like to take note of this report, which reflects the progress achieved in executing and implementing the policy for cooperation for health development in the Americas. We value the mobilization of resources, both human and financial resources, so as to provide support to inter-country cooperation. In spite of the challenges, the budgetary challenges, your own resources have been allocated to this form of cooperation, and external resources have been mobilized as well, both in kind and financial, and has promoted, therefore, the partnership and cooperation between countries who are members of the United Nations system and other partners. In this context, we believe that cooperation between countries continues to be a fundamental means of cooperation in order to move forward in cooperating post-pandemic and promote development in health areas. Amongst the activities coordinated by the Executive Secretariat of the Council of Ministers of Health of Central America and the Dominican Republic, COMISCA, is an example. They have collaborated in defining the type of mobilization and the standards of living of migrant workers within the member states of SICA, and have talked about opportunities for improving the health of these populations. Panama will continue to support cooperation between countries for the cooperation of for the development of health resources through regional integration cooperation mechanisms and with other partners in order to promote this kind of cooperation as a mechanism to move us forward in the health agenda of the region and the sub-region of Central America and the Dominican Republic. Thank you very much.
We have come to our lunch break, and before we do that, I'm going to ask the Secretary, Ms. Lou Valdez, to give any announcements.
Thank you, Mr. President. We would like to remind our delegates that the 177th session of the Executive Committee will be taking place in Room B immediately after the Directing Council ends this afternoon. Let me remind us who our Executive Committee's members are: Brazil, Canada, Colombia, Ecuador, El Salvador, Guyana, Haiti, Mexico, and Peru. Thank you, Mr. President.
Thank you. We will resume at 2:30, and we will continue on this item, and then thereafter we'll do item 7.9, item 8, and item 9. Thank you.
Because, as around the world, cardiovascular diseases are the leading cause of death. But so many of these lives could be saved with better control of hypertension. If we could raise population control from 36 to 50%, we would prevent nearly 440,000 deaths and almost 3 million cardiovascular events. From the global vision of the World Health Organization came hearts. In the Americas, as around the world, cardiovascular diseases are the leading cause of death. But so many of these lives could be saved with better control of hypertension. If we could raise population control from 36 to 50%, we would prevent nearly 440,000 deaths and almost 3 million cardiovascular events. From the global vision of the World Health Organization came hearts. The Pan American Health Organization, with leadership from the Ministries of Health of the region, expanded that vision into Hearts in the Americas, a strategy for quality improvement. Today, 33 countries are committed. More than 9,900 health centers are implementing Hearts, reaching 42 million adults. We are transforming primary health care with the Hearts clinical pathway, promoting team-based care and the use of data for continuous cycles of improvement. In 2025, over 6.3 million adults are receiving treatment, and more than half already have their blood pressure under control. But our story is still being written. Over 200 million adults in the Americas live with hypertension. And our goal is clear, that everyone has access to better care. This is Hearts in the Americas.
Los casos de sífilis están en aumento en América Latina y el Caribe, con un aumento del 30% entre los adultos de 15 a 49 años. Esta enfermedad afecta a personas de todas nuestras comunidades y se propaga rápidamente, pero tenemos el poder de detenerla. La sífilis congénita representa una amenaza seria para los recién nacidos, pero podemos prevenirla. Ahora es el momento de actuar. Las pruebas integradas y el tratamiento oportuno son esenciales para proteger a nuestras comunidades. Para más información, visita pajo.org.
Aging opens up a world of possibility. The possibility of continuing to do what we love and be who we are. But without the right support, aging can also bring limitations. Poor health, vulnerability, loneliness. We believe that a safe, caring, and supportive environment can turn aging into an opportunity to be healthy, to live fully, to embrace change, and keep learning and developing. We believe all people have the right to thrive at any age. Adding dignity to years, well-being to years, life to years. It's the decade of healthy aging in the Americas, adding life to years.
On November 14, 1924, in Havana, Cuba, history was made for public health in the Americas. The Pan American Sanitary Code was signed ad referendum by representatives from 18 nations at the Assembly Hall of the Academy of Medical, Physical, and Natural Sciences, now known as the Carlos J. Finlay Historical Museum of Science. This code, later ratified by all countries in the Americas, defined the duties of the Pan American Sanitary Bureau, today known as the Pan American Health Organization, PAHO. It established clear responsibilities for countries to report disease outbreaks, standardize prevention and control efforts, and gather crucial health data. This collaborative approach, rooted in the values of Pan-Americanism, recognized that health cooperation was essential, not only for the well-being of each country, but for fostering safe international trade across borders. Even today, a century later, the Pan American Sanitary Code remains a guiding force, continuing to shape PAHO's mission to promote the health and well-being of individuals, families, and communities across the Americas. This code stands as one of the most remarkable achievements in health policy, uniting nations under a shared commitment to public health excellence. In 2024, a century after the signing of the code, we honor the legacy of its architects, as PAHO and its member states persist in their efforts to improve the health and well-being of all people in the Americas.
Our success has been through governments and the dedication and commitment of our health workers and our policymakers. Everywhere where there is a community, you can train people from the community in doing diagnosis and treatment and report to you.
Próprio esforço do grupo, nós temos pessoas aqui dentro da malária que realmente estão dispostas a fazer o trabalho com motivação e carinho. Trabalhar com a própria comunidade foi a chave para chegar onde chegamos.
I would like really to congratulate these health workers in this area because I experienced the challenge they are facing to reach these places. You can't do that if you are not committed.
I think in the foreseeable future, we can envision a malaria-free Amazon.
We can change the life of many people by reaching this elimination goal.
Yo me llamo Daniela Gómez, me dedico a pintar, ilustrar y hacer murales también, pinturas en formatos grandes sobre nuestro entorno, con nuestra cultura. Me gusta mucho pintar.
Está muy bonito y muy alusivo a lo que en estos momentos está pasando con lo de la fiebre amarilla.
Estamos en el municipio de Ataco, un municipio que queda al sur del departamento del Tolima, hace parte del Foco Sur. Es uno de los municipios que tiene un número importante de casos y una letalidad bastante alta, es decir, tenemos 9 muertos como producto de la fiebre amarilla.
Entonces nosotros queremos, mediante el arte, poder llegar a la gente y poder invitarlos a que lo vean como algo amable, que se dejen de lado los mitos de que es algo malo y pues tomen la decisión de vacunarse para salvar las vidas.
Tu salud es tu poder. Claro que sí, porque es lo más indicado. Uno puede tener muchas cosas y puede tener todo, digamos, pero si no tiene la salud, que es lo primordial, no puede disfrutar, no tiene nada si no tiene salud. Estamos haciendo este mural como parte de una estrategia para llegar a la comunidad, para sensibilizarlos de la importancia de la vacunación. Queremos que la comunidad entienda que acceder a la vacuna es de manera gratuita, que es solo una dosis para prevenir la enfermedad durante toda la vida y que es el poder que nosotros tenemos como personas, como humanos, para enfrentar este brote de fiebre amarilla en el departamento del Tolima y en todo el país.
Me parece excelente idea para que la gente tome conciencia y se vacune.
Welcome. Let's take a journey to understand how PrEP, or pre-exposure prophylaxis, can protect you from HIV. We'll explore the science behind this powerful prevention tool.
Oral PrEP are pills used to prevent HIV. But how exactly does it work?
Once you take the pill, it dissolves in your stomach and gets absorbed into your bloodstream, where it travels to areas where HIV might enter, like genital and rectal tissues. PrEP is made up of 2 main medications, tenofovir and emtricitabine. HIV typically targets CD4 cells, which are crucial for your immune system. But this is where PrEP steps in.
The medications in PrEP block the virus from replicating in CD4 cells, preventing it from establishing an infection.
By stopping HIV from copying itself inside your CD4 cells, eventually it dies off. This keeps your CD4 cells healthy and strong, effectively preventing HIV from spreading and thus transmission.
PrEP is highly effective when taken as prescribed.
It's a powerful tool that allows you to take control of your sexual health and live without fear. For those who prefer not to take a daily pill, there's an alternative called PrEP on Demand or event-based PrEP. This involves taking 2 pills 2 to 24 hours before potential HIV exposure, followed by 1 pill 24 hours after the first dose and another pill 48 hours after the first dose. This method is ideal for people who don't have frequent sex and can't plan ahead. PrEP is recommended for people at higher risk of HIV. Side effects of PrEP are rare and usually mild, like nausea or headaches, and they typically go away after the first few weeks.
The best part, PrEP is over 90% effective at preventing HIV when taken as prescribed.
Talk to your healthcare provider to see if PrEP is right for you.
If using condoms isn't an option, PrEP puts you in control of your sexual health.
For more information, visit paho.org or talk to your healthcare provider today.
Life is better with PrEP.
Eu só ficava com o olho parado olhando para cima. E eu me desesperei, eu achei que ela ia morrer.
Ele não respondia, a gente falava, ele não respondia, usando fralda, né? Estava bem magra.
Tuberculose, criptococose e histoplasmose são as 3 principais infecções oportunistas que mais matam pessoas com AIDS hoje em dia. A diferença dos testes rápidos para os métodos convencionais é que em 30 a 40 minutos nós conseguimos saber qual é a infecção oportunista que está acometendo essa pessoa.
E a gente ter um método diagnóstico rápido para fazer, ter certeza do que a gente está tratando faz muita diferença.
Agora já caminho um pouco sozinho, né? Evolucionei.
Aprendendo a caminhar de novo que nem um bebê.
Pra quem tava em cima de uma cama, sem falar, sem se mexer, isso é ótimo, né?
Eu me levantei, caí, tomava banho com a mãe, aqui com cima eu tomava banho sozinho, e agora sim, tudo eu agora.
Nós somos um grupo que se sensibiliza muito com as questões de HIV e AIDS. E eu chego até a me emocionar para falar deles. Mas que, de fato, é uma equipe que faz muita diferença, assim, no trabalho aqui em Porto Alegre. E que tem muita vontade de mudar as condições materiais de vida das pessoas.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Pues me manejo mucho en esto internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa, lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud y acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área da telesaúde. Isso aí, para mim, é como fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Antes, planear la adquisición de vacunas, medicamentos y suministros podía tomar a los países horas y múltiples hojas de Excel. Hoy, todo se hace en minutos en un solo portal. Este cambio inició en el 2023 con el lanzamiento del portal de Estados miembros de los fondos rotatorios de la OPS, una plataforma en línea para los países que permite centralizar la información y los procesos de compra del Fondo Rotatorio de Vacunas y el Fondo Estratégico. Cada año, los gerentes de programas nacionales de salud pública que participan en los fondos consolidan las necesidades de medicamentos, vacunas y otros suministros para sus poblaciones y las envían a la OPS, quien realiza una compra conjunta con todas las solicitudes recibidas de la región. En el pasado, los gerentes de programas realizaban estas solicitudes completando hojas de cálculo, pero hoy solo toma unos cuantos clics. Esta plataforma es una ventanilla única que agiliza el trabajo y fortalece la salud pública.
Me parece que es algo muy positivo para nosotros, nos agiliza mucho más. Obviamente estamos viendo que todo se va modernizando y se van generando herramientas digitales. Me parece que está muy bueno.
Tras su lanzamiento, el portal ha incluido mejoras, como un rediseño de su interfaz y 2 nuevos módulos en junio de 2025. Seguimiento a finanzas y compras, con los cuales los usuarios pueden monitorear recursos, línea de crédito y el avance de sus pedidos en tiempo real.
Nos permite dar seguimiento a nuestros pedidos, a nuestros inventarios, a nuestras necesidades, y eso siempre representa una ventaja para el funcionamiento de la cadena de suministros, especialmente para nuestras instituciones que somos prestadores de servicios de salud.
Tras 2 años de su lanzamiento, el portal tiene 800 usuarios activos. Los módulos de finanzas y compras se han consultado más de 1.500 veces y ha permitido la entrega oportuna de los planes de demanda anuales por su facilidad de monitoreo en tiempo real.
I'm happy for the digitalization. This is an easier way of doing it.
Los fondos rotatorios regionales de la OPS continuarán buscando mejorar la experiencia y la transparencia en la información, facilitando así la rendición de cuentas en sus Estados miembros para ofrecer cooperación técnica sólida, demostrando que juntos somos más fuertes.
El cáncer infantil afecta a miles de familias en el mundo cada año, generando angustia y sufrimiento. En la región de las Américas, los gobiernos, la OPS y sus socios se han unido en la iniciativa Cure All para afrontar este desafío y devolver la esperanza.
Desde el año 2019, la Organización Panamericana de la Salud, en colaboración con el St. Jude Children's Research Hospital, trabaja incansablemente para mejorar la detección oportuna del cáncer en niños, niñas y adolescentes. En Latinoamérica y Caribe estamos logrando que más países prioricen el cáncer infantil y lo incluyan en políticas públicas que contemplen actividades para promover el diagnóstico oportuno. En los últimos 5 años, se ha incrementado por lo menos en 3 veces el número de países que cuentan con una guía nacional de detección precoz y sistemas de referencia. Ya estamos viendo los primeros resultados y se está logrando que más niños puedan llegar temprano a su diagnóstico, que más niños puedan tener estadios precoces de enfermedad y que amplíen la posibilidad de curarse.
En el Perú, hemos logrado reducir el 50% del tiempo diagnóstico en un lapso de 5 años. Principalmente desde la Iniciativa Mundial de Cáncer Infantil. El tiempo en el que los profesionales de la salud, médicos y enfermeras, demoraban para hacer el diagnóstico en niños desde la sospecha de cáncer se ha reducido de manera significativa. Actualmente, los niños y adolescentes llegan más rápido a los establecimientos de salud. Este logro es un trabajo conjunto desde el Ministerio de Salud a través de políticas públicas que impulsan la detección temprana de cáncer infantil, asimismo el fortalecimiento de las capacidades de los profesionales de la salud, la sensibilización de la comunidad para poder realizar un diagnóstico oportuno y, por supuesto, la participación de la sociedad civil organizada.
Hemos logrado disminuir en un 50% los casos de estadios avanzados de cáncer en los niños. Esto significa que más familias reciben un diagnóstico temprano y más niños tienen una oportunidad de vida, educando y sensibilizando al personal de salud y a la población.
La Organización Panamericana de la Salud pone a disposición de los países diversos recursos técnicos, como cursos virtuales, talleres y guías interactivas para fortalecer la capacitación de los profesionales de la salud, así como materiales para campañas de comunicación dirigidas a los padres y a la comunidad en general.
A través de Cure All Americas, también se está apoyando a los gobiernos en el monitoreo sostenible y uniforme de sus progresos, así como en la implementación de políticas de salud que fortalecen el acceso al diagnóstico temprano, tratamiento y cobertura financiera. Todo con un objetivo, un diagnóstico temprano que salve vidas y mejore el futuro de nuestras familias y comunidades.
Cada intervención en salud pública, cada acción coordinada y cada esfuerzo compartido son pasos hacia un futuro donde hay más niños que puedan superar el cáncer.
Un diagnóstico temprano salva vidas.
Hola, hoy vamos a conocer el alfabeto de las hepatitis virales. Las hepatitis A, B, C, D y E pueden dañar el hígado y algunas de ellas se transmiten por contacto sexual. Comenzaremos explicando qué es la hepatitis viral. La hepatitis es una enfermedad causada por un virus que provoca la inflamación del hígado y puede producir epidemias, cáncer de hígado y hasta la muerte. Los síntomas de los 5 tipos de hepatitis son similares: fiebres, náuseas, vómitos, dolor abdominal, erupciones en la piel, pérdida de apetito e ictericia, o sea, coloración amarillenta de la piel. A veces, las hepatitis no presentan los síntomas, hasta varios años después de infectarse, pero para ese momento el hígado puede tener daños graves. La hepatitis A puede adquirirse por alimentos o agua contaminada, falta de higiene o por contacto directo con una persona infectada. Los síntomas aparecen de 2 a 3 semanas después de infectarse. Se puede prevenir a través de una vacuna. A diferencia de la hepatitis A, la hepatitis B no se transmite por agua o alimentos contaminados. Se transmite a través de la sangre, por vía sexual o de una madre infectada a su hijo durante el parto. Muy importante, no se transmite por compartir utensilios de cocina, por besarse o estornudar. Los síntomas pueden aparecer de 1 a 2 meses después de la infección. En algunos casos no presenta síntomas, pero si el virus no se trata, puede ocasionar daños graves al hígado e incluso la muerte. La buena noticia es que se puede prevenir con una vacuna. La hepatitis C también puede transmitirse a través de la sangre y jeringas contaminadas, o también por vía sexual. Los síntomas pueden aparecer entre 2 semanas a 2 meses después de haber contraído el virus. Sin embargo, el 80% de los casos son asintomáticos. No hay vacuna para prevenirla. Pero la buena noticia es que existen medicamentos que curan la enfermedad en tan solo 3 meses. La hepatitis D es posible contraerla solo si tienes hepatitis B. También se transmite por vía sexual y a través de sangre contaminada. La vacuna contra la hepatitis B también te protege contra este virus. Y la última es la hepatitis E, pero no por eso es menos importante. Al igual que la hepatitis A, se transmite por agua y alimentos contaminados. Por eso es importante lavar bien las frutas y verduras antes de consumirlas, así como lavarse las manos con jabón después de ir al baño y antes de preparar los alimentos. Los síntomas aparecen entre 2 y 10 semanas después de adquirir el virus. Si piensas que podrías tenerla, visita el servicio de salud más cercano y pide hacerte la prueba. Y si quieres conocer más sobre las hepatitis, infórmate acá.
Dicen que hay lugares donde el camino se acaba, donde la carretera se convierte en mar y el viento en compañía. Pero también dicen que hasta allá llegan los compromisos más importantes, como el proteger la vida, para que nadie quede atrás. A la fecha, las coberturas vacunales en influenza superan los 6 millones en población objetivo. colaborando esto con la disminución de casos graves y muertes por virus respiratorios. En el marco de la campaña de vacunación e inmunización 2025 del Ministerio de Salud de Chile y la Semana de Vacunación en las Américas, la OPS-OMS Chile, junto a un equipo del Programa Nacional de Inmunizaciones del Ministerio de Salud y autoridades regionales, emprendió una travesía hacia los rincones más australes del continente americano. 3 días, más de 4.500 kilómetros, un viaje impulsado por un propósito claro, una sola misión: llevar vacunas a quienes se encuentran en zonas aisladas o de difícil acceso en el país, llevar vacunas a donde nadie más llega. Desde Santiago a Balmaceda, de Balmaceda a Coyhaique, nuestra primera parada. Allí reconocimos la clave del éxito de la vacunación en esa remota zona. Un equipo de salud altamente comprometido, que camina de la mano de líderes y lideresas comunitarias que convocan a mujeres y hombres, niños y adultos mayores, para llegar a todas y todos. Además, cuentan con el apoyo intersectorial de las alcaldías, diferentes estamentos del Estado y la sociedad civil en general. La tradición de proteger a su pueblo a través de la vacunación es parte del ADN de Chile, desde las primeras campañas del siglo XVIII hasta la rápida y eficaz respuesta frente a la COVID-19. Nuestro país ha liderado con ejemplo, dejando una huella imborrable a nivel mundial. De Coyhaique partimos por tierra hasta Puerto Cisnes, y desde allí zarpamos iniciando la travesía que nos llevó al corazón de comunidades apartadas. El equipo bordó ambulanchas, botes adaptados como verdaderas clínicas flotantes, para llegar hasta Puerto Gaviota, una comunidad a la que solo se accede por mar. Ahí, entre rocas, cerros verdes y mar indómito, se vacunó a niños, niñas y adultos mayores. El segundo día el equipo zarpó hacia Isla Gala, rodeados de volcanes y fiordos. Nuevas distancias, nuevos desafíos, mismo objetivo: proteger a la población. Cada dosis aplicada fue un acto de cuidado, una promesa cumplida, una señal de que la salud pública no tiene fronteras. Finalmente el equipo regresó a Coyhaique. Misión cumplida, vocación intacta. La travesía terminó, pero el compromiso sigue. Porque llegar a los rincones más alejados no es solo una meta logística, es una declaración: que nadie quede atrás, que la salud es un derecho y que en Chile se vacuna hasta el fin del mundo. Estamos seguros de que Chile logrará las metas establecidas por el país según las recomendaciones de OPS-OMS.
Amid a challenging security environment, vital work by the Ministry of Public Health and Population is strengthening routine immunization services in Haiti. Supported by PAHO and funded by the Canadian government through the Can Give initiative, these efforts seek to ensure equitable access to life-giving vaccines for vulnerable communities and groups, including girls and pregnant women. Through 3 regional exercises, 105 department-level trainers receive important updates on vaccination norms and protocols, including on COVID-19 vaccines, which have been integrated into Haiti's national immunization program. Through Cascade training, these regional trainers then share their knowledge with nearly 400 health providers. In addition, 124 health providers involved in epidemiological surveillance were trained in specific protocols for surveillance of vaccine-preventable diseases. And 221 health facilities benefited from supported supervision to ensure their compliance with vaccination quality standards. In 2024, more than 421,000 Haitian children received critical vaccinations through catch-up campaigns and routine services. And as Haiti faced recurring cases of deadly diphtheria, PAHO supported the vaccination of more than 340,000 children against the disease.
Oh oui, vaccin li gen an pile importance dans cadre routine et raison c'est parce que gen zone qui vraiment éloigné. Des fois, parents pas de possibilité pour les mener ti moun dans centre là pour les venir faire vaccin. Des fois, négligence parents tout et les nouveaux équipes souterrain comme ça a vraiment aidé parents yo, aider ti moun yo pour capable faire vaccin dans localité côté que yo vivent là.
Parler des maladies évidemment par la vaccination, nous apprenons et diphtérie. Effectivement, c'est un cas de diphtérie suspect que l'équipe aidée là a fait réponse. Et nous en pleine activité de réponse. J'en ai remarqué, nous cherchons rougeole, rubéole, nous cherchons syndrome rubéole congénitale, qui est moins d'un an. Nous cherchons catankou paralysie flasse aiguë. Nous cherchons surtout Kaiti et moun qui gen moins que 15 ans.
El tracoma es una enfermedad infecciosa que afecta principalmente a los párpados, posteriormente a la córnea y puede dejar invalidado a un paciente produciéndole una ceguera permanente e irreversible. Se contagia de forma directa, es decir, de persona a persona.
En especial los niñitos, digamos, se tocan y pueden estar dando la mano a otro niño y así se puede contagiar, ¿no?
Cuando ya tiene triquiasis ya se van sacando las pestañas, sino depilando, le estorba ya.
Esta enfermedad se ve principalmente en zonas con poca o ninguna sistema sanitario.
Donde no haya agua segura.
Con dificultad sistemas de alcantarillado.
Han levantado ya hace más de un año un tanque, han puesto agua, han hecho pozos, pero el agua no es buena.
Cuando estamos mal de los ojos nos afecta, ¿no?
no solo en Las Flores, ¿no? Sino en distintas comunidades. Hay deficiencias, ¿no? En el tema de lo que es salud y de educación más que todo, ¿no?
Nunca me hablaron del tracoma. No sabía de esta enfermedad.
Nunca había escuchado del tracoma.
Para nosotros es por primera vez que han venido a ver los ojos de nosotros.
Nunca había escuchado esa enfermedad tracoma.
Nunca había escuchado de que se pueda contagiar la enfermedad tracoma así con la mano sucia.
Dentro del registro que nosotros manejamos como Ministerio de Salud, no tenemos incidencia, ¿no? A nivel nacional, ¿no? Sin embargo, tenemos países vecinos en los cuales sí ha sido un problema de salud pública. Es por ello que estamos ejecutando este proyecto, que es una evaluación rápida para tracoma ocular en comunidades vulnerables, ¿no? Una vez termine este proyecto, nosotros vamos a tener la capacidad de poder determinar si tenemos o no y si realmente el tracoma ocular para nosotros es un problema en salud pública.
En esta actividad también hemos diagnosticado otras patologías además del tracoma y bueno, como Ministerio de Salud estamos programando ya actividades también para poder atender estas otras patologías como son las cataratas y pterigio, que son de mayor relevancia en la población adulta o mayor. Estaremos visitando el departamento de Pando, las comunidades indígenas, posteriormente el departamento de La Paz, el norte de La Paz específicamente, porque son las comunidades indígenas que estamos priorizando para poder ampliar la cobertura en la búsqueda de la patología denominada tracoma.
Esta enfermedad puede tratarse con una higiene adecuada. No se trata solamente de venir y curar, se trata de venir y enseñarles cómo cuidarse. Eso es más importante que, te diría, el mismo tratamiento por sí mismo.
Estamos a 15 kilómetros de la cabecera municipal que es San Lucas Tolimán y a 250 kilómetros de la ciudad capital de Guatemala.
Tuvimos una semana de capacitación bastante intensa en la cual nos dieron a conocer sobre tracoma, que era una enfermedad infecciosa prevenible, tratable y que es también una de las causas de ceguera a nivel mundial, que está producida por una bacteria que se llama Chlamydia trachomatis y que normalmente nosotros podemos manejar a nivel domiciliar con tratamiento.
La enfermedad del tracoma, ¿verdad?, que es lo que estamos ahorita manejando, pues se ha dado en diferentes comunidades del país. Entonces lo que se quiere ahorita es verificar la prevalencia que existe esa enfermedad dentro de la comunidad. Entonces, la temática es pues realizar visitas domiciliarias, realizar el examen ocular a todas las personas que vivan en la vivienda de 1 año en adelante, ¿verdad?, para detectar en qué tipo de población se está dando la enfermedad.
El cual consiste en una inspección exterior del ojo, ¿verdad? Luego se les solicitará a la persona muy amablemente a que pueda inclinar la cabeza hacia arriba y nosotros poder visualizar el párpado superior, ¿verdad?
Según la OPS, existen unos antecedentes en la cual se ha desarrollado esta enfermedad, por el cual estamos realizando estas actividades y es importante verificar en cada una de las casas, ¿verdad? Específicamente en los lugares más postergados, en donde existen pobreza, se podría decir también, como deficiencia de agua o la contaminación de letrina.
Esta jornada es muy importante porque viene a apoyar a las personas. Recordemos de que los puestos de salud quedan en los pueblos y hay personas que por el escaso recurso que tienen, pues les es difícil. Y muchas veces también de repente sienten los síntomas, pero las personas no acuden a los puestos de salud.
Parte de la prevención para esta enfermedad sería el adecuado lavado de manos y cara, específicamente en la región de los ojos. Entonces, dentro de los planes que nosotros tenemos es, aparte de realizar la evaluación, darle un buen plan educacional a la familia para que ellos puedan comprender la necesidad de la higiene que deben de tener en el domicilio. Aparte de eso, también tenemos que hay comunidades que tienen dificultades con el agua y también darles explicación de cómo poder utilizar el agua de mejor manera y que con eso pues, pueda mejorar el lavado o la limpieza general.
Conformamos parte del equipo nacional de Tracoma conjuntamente con el apoyo de Canadá, Organización Panamericana de la Salud y parte del Ministerio de Salud también. Conjuntamente lo hacemos esto para detectar y eliminar la enfermedad de tracoma.
HEARTS is an initiative of the Pan American Health Organization and the Ministry of Health, which aims to improve heart health and save lives by standardizing hypertension treatment, promoting healthy lifestyles, and strengthening primary health care.
The chronic non-communicable diseases are the leading cause of death in Grenada. Within the top 3, we have the cardiovascular diseases. For these reasons, we welcome the introduction of the HEARTS Initiative.
At the core of the HEARTS Initiative is the HEARTS Protocol, which provides a standardized approach to hypertension management and cardiovascular disease prevention in primary health care. It includes standardized treatment, effective and accessible medications, risk-based care, team-based approaches, healthy lifestyle promotion, and the strengthening of primary healthcare systems.
The integration or initiation of HEARTS has introduced a standardized approach to the way we manage high blood pressure patients.
The HEARTS protocol includes simple, standardized, proven treatments and interventions that can be easily incorporated into primary health care.
As part of the HEARTS program,
We have standardized blood pressure reading, ensuring that all categories of staff know how to check blood pressure. So in case a patient comes to the facility, anyone can assist them in checking their blood pressure.
The HEARTS protocol emphasizes a team-based approach which expands the responsibilities of hypertension management beyond primary healthcare physicians to include nurses, pharmacists, nutritionists, and other healthcare professionals, so that they too play a significant role in saving lives.
As nurses, we ensure that our patients are compliant, making sure that they monitor their blood pressure as often as possible, take the medication, come to visit the doctor when they are low on the supplies, follow up with the nutritionist as well. And if they have any issues or concerns that they are, feel free that they can come in. If they're not feeling well, they could come in at any time and speak to any one of us for advice. And we can do the proper referral if it's hospital or to doctor.
So as nutritionists and dietitians within the healthcare, whether it's primary healthcare or secondary care, we employ what is called medical nutrition therapy. This involves doing a comprehensive assessment. We look at body measurements, we look at the biochemical markers, the labs and so forth. We look at lifestyles, we look at dietary indication, and we also do a full physical exam. Once we're completed, we do a nutrition diagnosis, and then we will recommend and put together a targeted care plan with interventions as to how we can get that person to improve the overall lifestyle. So whether it's becoming more physically active lifestyles, whether it's changing diet, whether it's ensuring that person gets adequate amount of nutrients and filling the gap where there are deficits. We know that if we can correct the diet, also if we can maintain an adequate foundation for health, we know that we can see better outcomes when it comes to heart health.
The HEARTS protocol emphasizes the use of effective, affordable, and widely available medications to improve hypertension management.
The medicines that we'll be using as part of the HEARTS initiative, they're somewhat designed to be less burdensome on the patient because the number of pills that the patients would be required to use to control their conditions are reduced, because now we are making use of combination therapy. So one pill will contain maybe your 2 high blood pressure medication that you're taking at present.
Medication that are available through the HEARTS initiative are heavily subsidized, right? Patients that are less than 60 would pay a small fee. Those who are over 60 and over, it would actually be free as per protocol that already existed.
Following the introduction of the HEARTS initiative, we anticipate better compliance among our patients. We anticipate a reduction in the number of individuals who have uncontrolled high blood pressure. And at the end, we anticipate that in the long run, a reduction in the number of complications and the number of deaths that we are seeing as a result of high blood pressure and cardiovascular disease.
Me siento inmensamente agradecida que este proyecto se haya cumplido, que es un sueño hecho realidad.
Con el trabajo conjunto con el Ministerio de Salud Pública y Protección Social, la Secretaría de Salud del Amazonas, el personal de salud en este hermoso territorio y el apoyo del Gobierno de Canadá, se ha logrado instalar un puesto de vacunación autosustentable en La Chorrera, que nos va a permitir almacenar vacunas y otros elementos, la distribución y hacer que la vacunación sea una realidad permanente en La Chorrera y los territorios, las veredas aledañas.
Uno de los puntos autosostenibles es este, que tuvo una inversión aproximada de 380 millones de pesos, más o menos $93,000. Estos recursos han permitido la modernización del punto de vacunación de La Chorrera y mejorado la calidad de prestación del servicio de vacunación en esta zona.
Cuando la Organización Mundial de la Salud sueña con la cobertura universal en la salud, es esto, es que todas las personas, sin diferencia, sin distinción, puedan tener acceso a tecnologías sanitarias tan eficientes y que han salvado tantas vidas como son las vacunas.
Acá en Chorrera tenemos 22 comunidades.
Nosotros tenemos comunidades que nos podemos demorar hasta 5 horas en llegar. Las temporadas de sequía o las temporadas de invierno nos impactan también negativamente. Cuando esos largos veranos llegan, el río se seca.
La cadena de frío en río.
Que baje la cava a hombro o el termo de vacunas a hombro por en medio de la selva, por trocha.
A las cercanas que están aquí si llegamos por tierra, caminando. Y ahora con esto, o sea, me favorece mucho porque pues ya puedo tener a la funcionalidad del congelador eléctrico y el congelador 24 horas.
Decimos que es autosostenible porque tiene 3 principios fundamentales. El primero es que usando energías limpias manejamos energía solar al 100%, ya que en la comunidad no se tiene conectividad eléctrica, sino ciertas horas del día. Tenemos recolección de aguas lluvias y tenemos unos filtros que nos purifican el agua para que el agua en el servicio sea limpia para el proceso de lavado de manos, desinfección y también para la limpieza de los equipos. Y tenemos una antena Starlink que nos va a permitir tener el sistema de información diligenciarlo en tiempo real. Nos va a mejorar esos atrasos que tiene el sistema de información. Nos va a permitir tener el servicio completo, como la norma lo dice, pero también como la comunidad lo dice.
Y ha sido de conocimiento y mandato de los superiores de que las 2 medicinas son muy importantes, la medicina tradicional y también la medicina occidental, desde todo el conocimiento que ellos tienen. Esos 2 conocimientos, esas 2 medicinas, tienden a cuidar la vida.
Nos permite brindar a la comunidad seguridad y confianza para que puedan volver a acceder al servicio de vacunación. Creo que sí, se van a acercar más familias, las mamitas van a tener confianza en que sí, ya tenemos un punto apropiado donde ellos pueden llevar a sus bebés a vacunar con toda la confianza del mundo.
Ver este cuarto frío aquí en nuestra comunidad, en plena selva, mejor dicho, es un beneficio para la niñez hasta los adultos mayores. Gracias, muchas gracias, gracias a Dios, gracias a ustedes por este proyecto hecho realidad.
Este proyecto permite facilitar la logística y asegurar que la vacunación, que es un derecho fundamental de la salud, esté permanente para la población de La Chorrera y las veredas aledañas.
¡Gracias, OPS!
I have children at home. I have 4 of them, so that's the 5th one. And it's the first time in life I have to come to hospital to get my baby. My name is Sandra Francis and I'm from Yarong Park Village, the beginning of Region 9. It's actually like 160 kilometers from here to there. And I find it's range from being far from home. But now I'm comfortable and as you can see, I find it like living with others and finding new friends, you know, and mixing around and we learn from each other in there.
Region 9 is a very vast area. We have 62 facilities. We have 5 sub-districts, and each sub-districts have various other health facilities attached to them. The SIP program, the SIP Plus program, came into existence in Region 9. So we had an online training course, and then we had a face-to-face training where the facilitators from Georgetown came down. The region is doing well in terms of maternal death because we haven't had a maternal death like 3 or 4 years now.
We enter the data into the computer. Whenever we have admissions, we enter them into the computer. When you pull up that mother's information, you will find it there, but in a hard copy, something you might not find the card anymore. It might be put away somewhere else that you can't find it.
I've worked at Georgetown Public Hospital before the system was implemented, so I know how it was to use the paper base. And transitioning to the electronic base, I have to tell you, it has been like such a great thing for us. I actually have a great example of when the system was very helpful to us. So we had a patient come in, she was unconscious, she actually had a seizure, so she was diagnosed with eclampsia. Being able to look at the system, we could tell like what her labs were right away, we could tell what her blood pressure was before, we could get a very clear picture of her trajectory throughout the pregnancy and up to when she was. We were able to tell her gestational age, we were able to know if to give her corticosteroids and how to best deliver her. So in the end, she had a good outcome.
This has been quite a transformation for our department, because prior to SIP, what we would have had is there was tremendous paperwork that had to be done.
When patients comes to admission, we used to have an increased surplus or increased volume of patients waiting for admissions. With the digital way, it's faster because physicians are pretty much aware of how the perinatology system works. So we input the information quicker and you don't have to do multiple copies in order to share to the different ward.
This is a very, very good decision-making tool in terms of maternal health policy and planning at the national and the regional level.
I think in Guyana over the last 4 years, we have made significant progress as it relates to reproductive health. We have PAHO, we have the Canadian government who has helped us. And so because of this assistance, we have accelerated what we've been doing. So I think in terms of sustaining what we've started, with our resources and with some help from our partners, we certainly would be able to sustain these gains.
My delivery date is anytime because I'm 38 weeks. Good. Yes. Yes. So I could feel my baby's really. I will stay. I have names, but I did not choose my baby name as yet. So when the baby born, then I will choose the names for my baby.
In the Americas, as around the world, cardiovascular diseases are the leading cause of death. But so many of these lives could be saved with better control of hypertension. If we could raise population control from 36 to 50%, we would prevent nearly 440,000 deaths and almost 3 million cardiovascular events. From the global vision of the World Health Organization came HEARTS. The Pan American Health Organization, with leadership from the Ministries of Health of the region, expanded that vision into HEARTS in the Americas, a strategy for quality improvement. Today, 33 countries are committed. More than 9,900 health centers are implementing HEARTS, reaching 42 million adults. We are transforming primary health care with the HEARTS clinical pathway, promoting team-based care and the use of data for continuous cycles of improvement. In 2025, over 6.3 million adults are receiving treatment, and more than half already have their blood pressure under control. But our story is still being written. Over 200 million adults in the Americas live with hypertension. And our goal is clear, that everyone has access to better care. This is HEARTS in the Americas.
Los casos de sífilis están en aumento en América Latina y el Caribe, con un aumento del 30% entre los adultos de 15 a 49 años. Esta enfermedad afecta a personas de todas nuestras comunidades y se propaga rápidamente, pero tenemos el poder de detenerla. La sífilis congénita representa una amenaza seria para los recién nacidos, pero podemos prevenirla. Ahora es el momento de actuar. Las pruebas integradas y el tratamiento oportuno son esenciales para proteger a nuestras comunidades. Para más información, visita pajo.org.
Aging opens up a world of possibility. The possibility of continuing to do what we love and be who we are. But without the right support, aging can also bring limitations. Poor health, vulnerability, loneliness. We believe that a safe, caring, and supportive environment can turn aging into an opportunity to be healthy, to live fully, to embrace change, and keep learning and developing. We believe all people have the right to thrive at any age. Adding dignity to years, well-being to years, life to years. It's the decade of healthy aging in the Americas, adding life to years.
On November 14, 1924, in Havana, Cuba,
Colleagues, we will now resume. Consideration of sub-item C, Cooperation for Health Development in the Americas, the Progress Report. And Cuba, you have the floor.
Señor Presidente.
Mr. Chairman, international medical cooperation that we have developed for over 60 years is perhaps the most concrete expression of Cuba's commitment to global health. Since 1963, when the first medical brigade went to Algeria, more than 650,000 health professionals have provided services in 165 countries. At the moment, 22,890 workers are working in 54 nations. Our cooperatives have reached the most remote corners of the planet, to the most needy people and the most neglected populations. We have saved thousands of lives, not only taken medication and treatment, but also consoled people, have given them hope and provided dignity. The interest of the Cuban people to do this has been essential to demonstrate to the rest of the world that solidarity in the area of health are necessary to have sustainable development and build a fairer and more equitable future for all. Following these principles, our collaborators have contributed in a disinterested manner, in a sometimes anonymous and free manner, to participate in natural catastrophes, epidemics, amongst them malaria, yellow fever, cholera, dengue, and Ebola, and in more recent years, the pandemic caused by COVID-19. In fighting in these two last health crises, the international contingent of specialized medicines in disaster and epidemics, which was created in 2005, worked to help the U.S. territories severely affected by Hurricane Catherine in September of that year. Beginning with that, the Brigade Henry Rip became a central pillar of Cuban diplomacy and health. Not only do they save lives, but demonstrate Cuba's commitment to international solidarity. In the fight against Ebola in 2014, the Cuban brigades went to Sierra Leone, Liberia, and Guinea-Conakry. That was coordinated through the World Health Organization and once again demonstrated the principle of cooperation, which defines the foreign policy of the Cuban government. In recognition of their work during those serious epidemics in 2017, the WHO gave this brigade, Henry Lynch, in the memory of Dr. Lee Jun-wook, a commemoration. Again, in the midst of the horrible pandemic caused by COVID-19, the Cuban collaborators helped contain the effect of the virus in 52 nations with 58 brigades. The most humble are very familiar with this. Those who are ignored, unprotected, very often they know when everything else fails, they know that our people are there to offer treatment, respect, and support them without borders or geopolitical interests. That's the very essence of our health system and a clear demonstration of our support of the principles that define the paradigm of One Health.
Thank you, Cuba. And I'll give the floor to the Bahamas.
Mr. President, the Bahamas is pleased to contribute to the discussion on Agenda Item 7.8C, Cooperation for Health Development in the Americas. We commend the Pan American Sanitary Bureau for its continued leadership in fostering regional solidarity and advancing health through South-South and triangular cooperation. Mr. President, as a small island developing state, the Bahamas recognizes the immense value of inter-country collaboration in addressing shared health challenges. We are proud to have participated in the Regional Antimicrobial Resistance Initiative, coordinated through CARICOM and supported by PAHO. This initiative enabled the development of our national AMR action plan, strengthened laboratory capacity, and connected our professionals to regional learning networks. The Bahamas supports PAHO's strategic approach to cooperation, which emphasizes convening and advocacy to elevate health on regional and global agendas. If cooperation is to be more than episodic, it must be embedded in sustainable systems that empower countries to act autonomously while benefiting from collective strength. The emphasis on tailoring cooperation to national contexts is sound. However, mechanisms must exist for smaller and less resource nations to fully participate and lead these exchanges. We welcome the integration of cooperation modalities into the upcoming PAHO Strategic Plan 2026 to 2031, and we encourage continued support for country-led initiatives that promote equity, resilience, and sustainability. In closing, the Bahamas reaffirms its commitment to Pan-Americanism and to working collaboratively with our regional partners to advance health development. We look forward to continued engagement with PAHO and contributing to shared solutions that benefit all. I thank you.
Thank you to Bahamas, and I give the floor to Trinidad and Tobago.
Chair, Trinidad and Tobago takes note of the progress report on cooperation for health development in the Americas and affirms the value of South-South and triangular cooperation for strengthening health development. These forms of collaboration are critical for the post-pandemic recovery, resilience, and technology transfer, and we welcome the opportunities they create for peer learning and solidarity. Our own in-country focus is the development of a people-centered model of care, supported by modern infrastructure, digital solutions, and strategies guided by scientific evidence. This requires close collaboration across all stakeholders in our health system to deliver services that meet global standards. Cooperation can play a decisive role in this effort. Technical assistance in introducing novel health technologies, developing digital health systems, and building human resource capacity will strengthen our ability to deliver care, efficiency, and equitably. We see particular relevance for support in priority areas such as non-communicable disease prevention and treatment, maternal and child health, communicable disease preparedness in the context of climate change, mental health, oral health, and the reduction of waiting times for diagnostics and surgery. Trinidad and Tobago remains committed to fostering bilateral and regional partnerships that advance technology transfer, training, and knowledge exchange. We look forward to working with PAHO and fellow member states to reinforce cooperation for health development and to strengthen preparedness for the future. Thank you.
Thank you, Trinidad and Tobago. I now give the floor to Brazil.
Senhor Presidente, agradecemos o relatório sobre cooperação para o desenvolvimento da saúde nas Américas. Reconhecemos as iniciativas regionais em curso e o papel central da OPAS na promoção da cooperação, expressão da solidariedade que inspira a integração regional. Entendemos que a cooperação entre países é indispensável para fortalecer a resiliência dos sistemas de saúde, reduzir as desigualdades e responder a emergências. Para consolidar avanços, é essencial garantir mecanismos... Okay. I think the interpretation.
The microphone is on. We understand that cooperation amongst countries is indispensable to strengthen the resilience of health systems, reduce inequalities, and respond to emergencies in order to consolidate the essential progress and ensure sustainable financing systems. Brazil supports the financing initiative, the complementary financing initiative, with financial institutions for regional and interregional, through mechanisms of the United Nations and triangular partnerships. We encourage PAHO to continue mobilizing resources. We would like to reiterate our willingness to work with other member states and PAHO to bring about a change to the commitments to long-lasting actions that reinforce our collective ability to deal with current and future challenges in public health. Thank you.
Thank you, Brazil. Now I will give the floor to two sub-regional mechanisms and a non-state actor in official relations who have requested the floor to make brief statements on this item. I give the floor to Komiska.
Muchas gracias, señor presidente.
Thank you very much, Mr. Chairman. On behalf of the Executive Secretary of the Council of Ministers of Health of Central America in the Dominican Republic, SECOMISCA, we express our appreciation for the report on cooperation for health development. We welcome progress made and recognize the leadership of PAHO. We particularly highlight the achievements in certain areas, mental health and psychosocial support in countries in the region such as Costa Rica, Guatemala, Honduras, and Panama. The establishment of technical working groups and training programs for training institutional capacity to prepare and respond to an emergency are extremely important. The dissemination of technical material and coordination between ministries of health with professional associations, universities, and international organizations is a clear example of effective cooperation and strengthening regional resilience. Likewise, we underscore the importance of temporary workers with the regional secretariat that has allowed to develop profiles, standards, and develop the immigration platforms. We understand the relevance of the cooperation that's taking place in other regions and with whom Comisca has signed cooperation agreements such as CARICOM and Eurascono, which demonstrates the importance of regional integration to deal with common health threats. We welcome the proposals to strengthen cooperation amongst countries, the health agenda and documents, and the replication of successful experiences in decision-making, and encourage the establishment of International Ministry of Health to develop capacities, promote solidarity between member states in a spirit of Pan-Americanism and regional health integration. We reiterate our commitment to work in a coordinated fashion with PAHO and member states and other international organizations so that health cooperation continues to be a strategic pillar that strengthens the joint challenges today and in the future. Thank you.
Thank you. And I'll give the floor to the Andean Health Agency, Hipólito Unanue Agreement.
Buenas tardes, señor presidente.
Good afternoon, Mr. Chairman and distinguished delegates. On behalf of the Andean Health Hipólito Unanue Organization, I'd like to congratulate you on the progress made by you and refer to 3 experiences we have had in the area of cooperating for health development with the CCHD. The South-South Cooperation for the early detection of child cancer in the Andean area allowed us to have a ministerial resolution adopted by the 6 countries of the Andean region, the PEMSA countries, where child cancer is considered a problem of public health, and they signed a roadmap with Orozcono, PAHO, and St. Jude's. We now have had 2 meetings in person with focal points talking about cancer at the ministries and with the focal points at PAHO, where they discussed joint activities, challenges, guidelines, and regional strategies. 2,324 health professionals and health professionals were trained in person. 1,150 health professionals were trained on a virtual manner, and we increased by 14,026 participants in the number of PAHO courses. We have 2 guidelines for early detection, 2 binational relations were adopted, 4 countries adopted a campaign, 2 subnational campaigns, and there were publications on good practices. The second project provides equitable access to the transplant of hematopoietic transplants, TPH, in the treatment of child cancer. We had a report of the diagnosis, the Andean coordination course on TPH. A regional guide was prepared on TPH with clear indicators. We had educational manual for parents and caregivers. We developed a platform for registry and the publication of good practices in South-South cooperation. And third, the project Health and Climate Change in the Andean countries led to a first international congress in research on climate change, which took place in August 2023. It was a hybrid meeting with the presence of 220 persons connected, 220 person and 1,000 connected. The most important thing were the technical visits of cooperation between countries. We had 10 professionals from the Ministries of Health of the Andean countries came to Colombia, the regional meeting, and later there will be more things done, which will be carried out until December of 2025. We believe that this cooperation between countries for health development are very positive and will allow us to continue working on behalf of health and the well-being of our communities. Thank you.
Thank you. I now give the floor to the International Federation of Medical Students Associations.
Boa tarde, estimado presidente, distintos delegados. A Federação
Thank you, Mr. Chairman and distinguished delegates. The International Federation of Students of Medicine acknowledges the significant progress in this report on cooperation for health development in the Americas and reaffirm the key role in strengthening health systems by cooperation between countries to ensure that they are inclusive and resilient throughout the region. We insist on the importance of keeping this mechanism as an engine for training and learning and for sharing the common challenges that face our borders. We would like to appeal to continuing providing this biannual progress reports so as to ensure transparency, evidence-based decisions, and the responsibility states have to implementing and measuring this, the impact this policy has. It's important to take into account those countries that are least involved in South-South cooperation to encourage them to participate and promote real equity in the Pan-American area and reduce the disparities in our region. By strengthening regional partnerships and interregional partnerships, and by taking advantage of regional integration mechanisms, including society, academia, and youth, will help us promote innovation and the transfer of technology and prepare for climate change emergencies. The important participation of youth in designing and implementing cooperation projects is important to ensure that their perspectives, creativities, innovative solutions be included in the regional health agencies. We are committed to supporting PAHO, member states, and all key actors in building a more healthy, just, and inclusive America without leaving anybody behind. Together, we must convert cooperation as a reality that is lived and experienced by everyone. Thank you.
Thank you. And I will yield the floor to Ms. Huerta to respond to the comments.
Thank you, Mr. President. Muchas gracias a todos.
Thank you to all the delegates who have made a contribution to this progress report: Canada, Panama, Cuba, Bahamas, Trinidad and Tobago, Brazil, and the sub-regional organizations such as Comisca or Ascono, and the International Association, rather the International Federation of Students of Medicine. I'd like to highlight some key words that have been mentioned by all of you, which I think give greater strength to this initiative that we've been implemented at the request of member states in the resolution adopted in 2013. It has now been strengthened by the fact that the organization is quite certain that country between countries, South-South cooperation, cooperation between regions, and sub-regional integration mechanisms is a technical cooperation methodology that is crucial to allow us to move forward in exchanging experiences and benefit from lessons learned in other countries so that we can then share them with others and make the path easier for others and achieve greater impact and results in public health amongst our populations. In the area of indicators, the issue raised by Canada and referred to by the Federation, I'd like to say that based on the comments we've received earlier, we've established an electronic platform so that you can record all the South-South experiences for development that are taking place, both those that are financed by the initiative with the organization's funds, as well as others that are financed with other funds, including cooperation that take place between countries without financing. However, we are also looking at the possibility of setting up some sort of system that would allow us to have more tangible measurements, either through indicators or some other way, so that we can do more accurate measurements. I also would like to reiterate what you've said about the importance of this initiative to develop partnerships and cooperation between countries. We've constantly heard the term solidarity and Pan-Americanism, which has been characteristic of the work PAHO has done in the area of health in its more than 175 years of working for the populations of the Americas. To acknowledge that the work done today through this South-South cooperation or triangular cooperation better prepares us for current challenges, but also for the challenges of the future. And it makes us realize it's important to have joint work so as to be able to establish cooperation agreements between countries. We also recognize the importance there is in promoting more harmonious work, better structured and organized work between the PAHO and the member states and the sub-regional integration mechanisms. It's a fundamental role. We know what this means, and we've taken note of your recommendations to keep this way of working and continue to encourage it in the present and in the future. Thank you.
Thank you. I would like to inform the Council that the discussions will be reflected in the final report. We now move on to Agenda Item 7.9, resolutions and other actions on the intergovernmental organizations of interest to the Pan American Health Organization, sub-item A, 78th World Health Assembly. I would like to bring the document CD62/INF/9A to the attention of the Council and invite Mr. Nicholas Lagomarsino, Senior Advisor of the Governing Body's Office of the Pan American Sanitary Bureau, to respond to the comments after discussion. I yield the floor to the representative of the Executive Committee to report on this item.
Thank you, Mr. President. Item 7.9, resolution and other actions of the intergovernmental organizations of interest to PAHO. A, 78th World Health Assembly. The Executive Committee reviewed a report in June on the resolutions and other actions of the 78th World Health Assembly and the 157th session of the WHO Executive Board, considered to be of particular interest to PAHO. It was noted that the 78th World Health Assembly adopted a number of landmark decisions and resolutions, including the world's first pandemic agreement. In the committee's discussion of the report, delegates affirmed their support for the pandemic agreement and for the ongoing work of the Intergovernmental Working Group charged with developing the WHO pathogen access and benefit sharing system provided for in Article 12 of the agreement. Delegates also applauded the leadership shown by countries of the region during the World Health Assembly and drew attention to several initiatives proposed by member states from the Americas, in particular the resolution on regulation of digital marketing of breast milk substitutes, proposed by Brazil and Mexico, and co-sponsored by numerous countries of the region. The resolution on mental health and social connection, sponsored by Chile, and also supported by numerous countries of the region. Thank you, Mr. President. This concludes my report on this item.
Thank you. I now invite the Directing Council to take note of this report and to provide any comments it deems pertinent I now open the floor to the plenary to begin discussions. I see no requests for the floor. Oh, sorry, Brazil.
Thank you very much, Mr. Chair, Mr. President. Muito obrigado.
Thank you very much, Mr. Chairman. Brazil would like to express its gratitude for the report on the resolutions in the 78th World Health Assembly, particularly the adoption on the pandemic agreement that is historic for multilateralism within the context of geopolitical tensions. Brazil took active part in the entire process, even with a representative in the Americas in the intergovernmental negotiating body. We welcome the progress and reaffirm our commitment with the continuity of the negotiations, in particular in the working group on access to pathogens and benefit sharing system. The agreement and its annexes will be essential in order to reduce inequities in future global pandemics. In connection with the Resolution 78.2, we support the strengthening of national offices in the sense of defending the search for sustainable funds and mobilization of resources in order to ensure equity, resilient, and stronger health systems. We support Resolution 78.2 for the World Health Assembly presented by Brazil and Mexico, as has already been stated, which regulates the digital framework on the digital marketing of breast milk substitutes. It is quite relevant and essential for the promotion of breastfeeding to reduce inequities in the Americas. Thank you very much.
Thank you, Brazil. No, I see no other requests. Nicholas, you.
Thank you, Mr. President. Sorry, my voice. No, thank you, Brazil, for the comments. And yes, we included in the report the resolutions from the one in the Executive Committee that have more relevance for the region, or those that were sponsored by our region, our member state from the region, and we look forward to continuing supporting and working for the delegations in the next cycle of the WHO, and especially this next year we'll have the presidency in the region. So thank you very much. Thank you, Mr. President.
Thank you. I would like to inform the Council that the discussions will be reflected in the final report. We now move to sub-item B, the 55th regular session of the General Assembly of the Organization of American States. I would like to bring document CD 62/INF/9B to the attention of the Council and invite Dr. Mariana Ferreira Teixeira, Interim Director of the Department of External Relations, Partnerships and Resource Mobilization of the Pan American Sanitary Bureau, to come to the head table and present the item.
Mr. President, Dr. Barbosa, distinguished colleagues and guests, I'm pleased to present sub-item B, including the item 7.9 of the agenda, regarding the 55th regular session of the General Assembly of the Organization of the American States, OAS. The 55th General Assembly of the OAS was held in St. John's, Antigua and Barbuda from 25th to 27 June 2025, under the theme Building Resilient and Inclusive Economies in the Americas. The document provided to member states presents resolutions relevant to the activities of the Pan American Health Organization that were adopted during this regular session of the General Assembly of the OAS. Adopted mandates of interest for PAHO include a resolution to address the mental health crisis in the Americas, a resolution related to the crisis in Haiti, and a resolution on integral development initiatives. Additionally, member states adopted a resolution on the program budget for 2026, which includes the OAS scale of quota assessments for the years 2026-2028. On the margins of the regular session, the government of Antigua and Barbuda and PAHO, with the support from the OAS General Secretariat, co-hosted a side event titled Uniting the Americas for Mental Health, From Commitment to Action, with the leadership of the Prime Minister of Antigua and Barbuda and participation of member states, ministers, and authorities. This event was an opportunity to leverage regional leadership on mental health ahead of the 4th United Nations high-level meeting on the prevention and control of non-communicable diseases and the promotion of mental health, held last week in New York. Finally, it is worth to mention that member states also approved a resolution establishing that the 56th regular session of the OAS General Assembly will be held in Panama City from 22nd to 24 June 2026. Thank you, Mr. President.
Thank you. I now invite the Directing Council to take note of this report and provide any comments it deems pertinent. I now open the floor of to the plenary to begin discussions. I see no requests for the floor. Director.
Thank you, Mr. President. Very briefly, first I want to thank the government of Antigua and Barbuda, because it was very important, this partnership that we established to have a side event on mental health and suicide prevention, and also all the negotiations that, as was reported by Mariana Faria, the resolution that was approved by the Organization of the American States on mental health. This is very important because it will reinforce our work together, and it will allow us to reach not only the health audience, but also the heads of states and ministers of foreign affairs that are a crucial part of this whole of the government response that you need to provide to mental health and the suicide prevention. Me gustaría también de...
I would also wish to express my gratitude to all ambassadors, the heads of permanent missions to the OAS and PAHO that have an important activity with us, and to pay recognition to the ambassador. She was with us this morning here. On her behalf, I'd like to pay tribute to all the ambassadors. The ambassador from Mexico, Luz Helena Baños Rivas. I understand that it was at the last Directing Council where she participated, and she's been here since 2019, so we send her greetings. And on behalf of the Ambassador Luis Helena Rivas, I also express my gratitude to all the ambassadors that are always ready to participate and to support health issues at the OAS. Thank you, Mr. President.
Thank you, Dr. Barbosa. I would like to inform the Council that the discussions will be reflected in the final report. I now move to sub-item C, item 7.9, sub-regional organizations. I would like to bring document CD 62/INF/9C to the attention of the Council and invite Ms. Piedad Huerta, head of the Country and Sub-Regional Coordination of the Pan-American Sanitary Bureau, to come to the head table. I now yield the floor to the representative of the Executive Committee to report on this item.
Thank you, Mr. President. Item 7.9, resolutions and other actions of intergovernmental organization of interest to PAHO. C, sub-regional organizations. The Executive Committee reviewed a report in June on the resolutions and other actions of various sub-regional bodies that were considered to be of particular interest to PAHO. The report also provided information on the progress of activities undertaken as part of the agreements between PAHO and those sub-regional entities for cooperation in a range of areas, including disease elimination, integrated approaches to non-communicable diseases, and emergency and pandemic preparedness. In the committee's discussion of the report, delegates welcome PAHO's collaboration with sub-regional integration entities and acknowledge the important role of such entities in achieving health results at the regional and global levels. The development of new PAHO cooperation strategy in the Caribbean was also welcomed. It was emphasized that all activities undertaken with sub-regional entities should be aligned with the new PAHO strategic plan for the period 2026 to 2031. Thank you, Mr. President. This concludes my report on the item.
Thank you. I now invite the Directing Council to take note of this report and to provide any comments it deems pertinent. I now open the floor to the plenary to begin the discussions. Brazil, you have the floor.
Thank you very much, Mr. President. Muito obrigado.
Thank you very much, Mr. President. Brazil has participated in regional mechanisms that promote debate against strategic actions in health. Mercosur is a priority for President Lula and for the Minister of Health, Alexandre Padilla. The Brazilian government provides incentive to devote its actions to regional integration. In July, we took on the pro tempore presidency of Mercosur, thus working on the agenda concentrated on emerging and current challenges. We're giving continuity to the efforts of the Argentine pro tempore presidency, digital health, mental health, the use of artificial intelligence and interoperability of data in order to promote transboundary vaccination based on fake news and the production of the vaccination in keeping with the European Union and Mercosur. Bearing this in mind, we're giving continuity to healthy and safe borders in Mercosur. We've already conducted several operations on the border with Uruguay together with PAHO. During this year, the Ministers of Health held a meeting in Quito, and thus we wish to reiterate our commitment to health in the Amazon. This is a huge event providing access to remote areas, direct connections, environmental conditions on the health of local populations. A special commission on health that was activated, which is CESAN, in the Amazon, bearing in mind regional cooperation. Ecuador will play an essential role in leading the work of the commission during this first cycle. For Brazil, this represents another opportunity to be able to translate into practice integrated actions in order to respond to the needs of the Amazon, transforming efforts into concrete results. Holding the COP30 in Belém do Pará, in the heart of the Amazon region, will attract the attention of countries to the reality of that region. We hope to have high-level participation on November 3rd, having delegates from all countries in our region. Thank you so much.
Thank you, Brazil. I now give the floor to Panama.
Gracias, señor presidente.
Thank you, Mr. Chairman. The delegation of Panama takes note of this document that reflects the progress in sub-regional technical cooperation with the main purpose of promoting strengthening of PAHO cooperation with integration processes between regions of the Caribbean, Central America, and South America. We greatly value cooperation among countries in order to move forward on cooperation and regional dialogue within the field of health, thus stressing the initiatives with organizations of the Central American Integration System, SICA, to continue fighting for cooperation among countries for health development and the positioning of health at the highest level of sub-regional agendas within the group of countries that are affiliated to these organizations. It is within this context that the sub-regional cooperation strategy of PAHO for Central America, Dominican Republic, and Mexico 2025-2031, signed on May 8, 2025, between PAHO, the Executive Secretariat of COMISCA, and the integration process and the development of Central America constitutes a framework that strengthens the technical political relation between PAHO and the countries in the sub-region. Based on common priorities, this strategy promotes integrated actions in order to deal with the determinants that are shared in health, to promote the regional public goods and promote intersectoral partnerships. Its implementation articulates sub-regional and global efforts in concordance with the mandates of PAHO in order to accelerate the progress towards universal health and well-being in high interdependence fields. It is essential that we strengthen strategies on critical issues such as the environment and climate change, which represent trans-border issues that call for coordinated and solidary responses. Health knows no border, and therefore strengthening sub-regional governance is key in order to manage these challenges in an effective way, promoting intersectoral cooperation and interoperability, institutional interoperability. Only thus will we be able to deal with success the emerging risks and guarantee the protection of our populations when faced with threats such as natural disasters, epidemics, and environmental crises. Panama holds the pro tempore presidency of the Council of Ministers of Health of Central America and the Dominican Republic, COMISCA, from July to December 2025, reiterating our commitment in order to work together with a comprehensive, inclusive, and sustainable approach in order to move forward to a healthier, equitable, more equitable, and resilient region. Only through cooperation and innovation, as well as through shared commitment, we will be able to live up to our mission to protect and promote the health of our population in our countries. Thank you.
Thank you, Panama. Now I'll give the floor to two sub-regional mechanisms that have requested the floor to make brief statements under this item. COMISCA, you have the floor.
Muchas gracias, señor presidente.
Thank you very much, Mr. President. The Executive Secretariat of the Council of Ministers of Central America and the Dominican Republic expresses its most sincere gratitude addressed to the Pan American Health Organization for the technical and political support provided in regional integration processes, which have enabled us to move forward jointly in building public health goods and in articulating collective answers to common challenges. We acknowledge, and in particular, it is with great satisfaction that the Sub-Regional Cooperation Action of Central America, Dominican Republic, and Mexico 25-2031 that was signed in May this year, which strengthens the political technical work of APAHO in our countries, aligned with regional priorities and with a shared vision of accelerating universal access to health and well-being in the context of high interdependence. We also stress the support provided by PAHO within the framework of COMISCA space that constitutes the main political forum on health in the sub-region, where we're promoting key resolutions for digital health, health promotion, health regulation, the elimination of communicable diseases, and strengthening human resources on health, amongst others. Likewise, we greatly value the cooperation articulated with other agencies of the Central American Integration System, such as the Central American Commission for Environment and Development, also the Mesoamerica Project, that have opened up opportunities to deal with environmental determinants of health, to promote joint initiatives on climate change, the quality of the air, and to strengthen resilience in our health systems. COMISCA reiterates its commitment to work collectively in an articulated fashion with PAHO in the units of CISCA to move forward with a more resilient system, inclusive and equitable systems with an approach of One Health that will respond in a solidary way to the needs of our population and will constitute the sustainable development for Central America and the Dominican Republic. Thank you.
Thank you. I now give the floor to the Amazon Cooperation Treaty Organization.
Excellencies, distinguished ministers, ambassadors, colleagues all. Let me begin by expressing our gratitude for the invitation to participate in this important space for sub-regional mechanism. We recognize fully the strategic value of this dialogue, which strengthens cooperation. On behalf of the Amazon Cooperation Treaty Organization, an intergovernmental cooperation body that brings together 8 member states, Bolivia, Brazil, Colombia, Ecuador, Guyana, and Peru, Suriname, and Venezuela, I wish to convey our sincere appreciation to the Pan American Health Organization. Through our joint efforts and work, PAHO has supported us tremendously in the development of the Amazon Health Plan, and more importantly, I must emphasize the reactivation of the Special Commission on Health of the Amazon, referred to as CSAM, within the framework of the ministerial meeting of ACTO member states that was held in Quito of this year in July. These milestones has given new political and technical momentum to the Amazon Health Agenda, supported as well by the Ministers of Foreign Affairs and the Presidents of the ACTO member states. The Amazon, with its diversity and global significance, requires coordinated and sustained efforts. As a governmental organization, ACTO reaffirms today our strong commitment to continue working closely with PAHO and do look forward for this tremendously through our coordination with countries and subregions in advancing the priorities as defined by our ministers and to ensure that health remains a central pillar of sustainable development in the Amazon basin. Once again, thank you very much on behalf of ACTO for this opportunity.
Thank you. I now yield the floor to Ms. Huerta to respond to the comments.
Thank you very much, Mr. President. Muchas gracias a la
I'd like to thank the delegations that have shared their comments in connection with this report. Likewise, to our sub-regional sister organizations that are present here today. As we all know, the sub-regional organizations play a key role in cooperation among countries, in particular, stressing the sub-regions, which is where we can share the shared interest in a more realistic, more pragmatic way. In order to optimize and have a more strategic cooperation with PAHO, as we have reported in the 2 years prior to this directing council, the organization came to the decision of getting involved in a process to develop sub-regional cooperation strategies with the sub-regional integration organizations in such a way that in March this year, we signed the Sub-Regional Cooperation Strategy for Central America, Dominican Republic, and Mexico. And in July, we signed the Sub-Regional Cooperation Strategy for the Caribbean with CARICOM. The Sub-Regional Cooperation Strategy for South America is in its final stage, and we hope that it can be signed in the near future with the 3 sub-regional integration mechanisms in South America. In these initiatives that have been carried out with a great participatory and collaborative way, we take into account the resolutions that have been adopted by the Pan American Health Organization, as well as by each one of these sub-regional integration mechanisms. It is very important to harmonize the work, to put priorities in order, and to focus technical cooperation to be able to have a more dramatic impact on improving public health of our populations. So we would like to express our gratitude in a heartfelt way with a great dedication to sub-regional cooperation organizations such as SECOMISMA, CARICOM, the Mesoamerica Project, OTCA, UN, for this opening that they've had in order to welcome this work shared with PAHO. I would like to thank Mari Carmen Calle, who is present here, the Secretary of Lorascono, who finishes her position as Secretary General, and to whom we express our profound gratitude for the shared work done and for the opening that Mari Carmen has had during her activity during UN hours together with PAHO. Thank you.
Director.
Thank you, Mr. President. Very briefly, just to reiterate our thanks to the sub-regional organization. I think that's very important that in recent years we have we were able to work together and to identify clearly what are the areas that we can, in a complementary way, to provide the better support to our member states. So I really want to thank Mercosul, Orascono, and OTCA in South America. We are very close to finalize the sub-regional cooperation agreement with the 3 sub-regional entities. I want also to thank and to welcome the new Secretary Executive of the COMISCA, that welcome, and for sure that we will continue our good work together. And also with CARICOM, that I signed the agreement in Guyana a couple of months ago. And it was really a very important moment because we were already developing some activities with CARICOM to advance this agreement. So I think that is the way to move forward. It's not competing, overlapping, but thinking how we can have a more synergistic cooperation with all the sub-regional mechanisms that you have in the region. So thank you very much for your cooperation.
Thank you, Dr. Barbosa. I would like to inform the Council that the discussions will be noted in the final report. And now we have come to item 8, other matters. Dr. Barbosa, are there any other matters that you would like to bring to the attention of the Council?
No, Mr. President, I don't have any. Thank you.
Now I open the floor to any delegate who wishes to propose other matters on this agenda item. I see no requests. I inform the Council. Mexico, you have the floor.
Thank you very much, Mr. President. Please allow me to take advantage of this opportunity to refer to the recent recognition done by Director Jarbas Barbosa to Ambassador Luis Elena Baños Rivas, representative of Mexico before the OAS. She is already been kept informed about your statement, and she has asked me that she wholeheartedly thanks you and your team for that very heartfelt message directed to the ambassador. Thank you.
Thank you, Mexico. I see no other requests. I inform the Council that these discussions will be reflected in the final report. We now go to the final item, item 9, closure of the session. As we conclude the session, I would like to invite the Director of the Pan American Health Organization to make some final remarks.
But I'll do my best. Sorry. Honorable President, Minister Walcott, Honorable Vice President of Argentina and Peru, esteemed President of our 176th session of the Executive Committee, Minister Frank Anthony, from Guyana, esteemed Rapporteur, Mr. Alejandro Alvarez, Human Rights Attaché to the Permanent Mission of Chile to the Organization of the American States, our Deputy Director, Marilu Valdez, who serves the Secretariat ex officio of this Council, Honorable Ministers and Secretaries of Health of WTO member states, distinguished member state delegates, representatives of non-governmental organizations in formal relation with the PAHO, fellow PAHO and WTO colleagues, honored guests, esteemed ladies and gentlemen, a very good afternoon to you all. As we end this 62nd session of Directing Council of the Pan American Health Organization, I am genuinely honored to feel the trust and commitment that you all have in this organization. We heard loud and clear your undeniable support and strategic guidance, reinforce our mandate to protect the health of the people of the Americas. The document and resolution discussed this week through one of the richest consultative processes that the Directing Council ever had. During these past 4 days, you have successfully navigated through 43 agenda items, reviewed 2 progress reports, 2 final reports, and approved 9 resolutions. On behalf of the entire Secretariat, I wish to extend my sincerest thanks and heartfelt appreciation to you all for your individual and collective contributions to delivering on this week's extensive tasks. Ladies and gentlemen, I would like to take a moment to briefly recapture the highlights of this week's deliberations. During this week, you discussed and approved vital resolutions related to PAHO's Strategic Plan 2026-2031, PAHO's budget policy, access to high-cost and high-priced health technologies, and the plan of action of non-communicable diseases. The approval of the Strategic Plan 2026-2031 will guide the strategic direction and desired health impacts and outcomes that the Bureau and Member States committed to collectively achieve by 2031. This strategic plan includes an extensive analysis on the current context, the impact of health challenges on health and well-being, the outlook and opportunities for the future, and the Bureau's role in accelerating progress. The policy for expanding equitable access to high-cost and high-price health technologies aims to ensure access for all to high-cost and high-price health technologies through strategies that promote comprehensive public health approaches. These strategies will take into account the life cycle of health technologies, their contributions to quality of care, and the increased life expectancy they offer to the population, as well as access barriers, gaps, and opportunities. The Plan of Action on Non-Communicable Disease Prevention and Control 2025-2030 will support member states in accelerating actions necessary to meet the global NCD targets. Recognizing that a whole-of-government and whole-of-society approach with multi-sector partnership is needed to address NCDs, the Plan of Action outlines 3 overarching strategic lines of actions to be implemented over its time frame. The Directing Council received also 3 briefing sessions. The first one on the launch of the report of the World Bank, PAHO, Lancet Commission on Primary Health Care and Resilience in Latin America and the Caribbean. This report emphasizes that resilience must be considered as a cornerstone of the primary health care. It offers recommendations to strengthen integrated service, essential public health functions, community empowerment and trust, multi-sector action and financing, all tied together by the need for sustained commitment and progress toward universal health and primary health care-based systems in Latin America and the Caribbean. Let me now switch to Spanish. La sesión informativa.
The briefing session on the advances in innovative approaches in the use of the regional revolving funds and in regional production and agreements to have a rapid response to outbreaks of pandemics and the introduction of new technologies to the funds portfolios. At that session, we heard about what different countries are doing to acquire treatment at a more competitive price for cancer. We also shared examples of the application of health technologies to prevent, diagnose, and treat cervical cancer, and the path towards the production of the regional distribution of the HPV-20 vaccine through the use of our revolving funds. The last session, briefing session on Wednesday, was on accelerating disease elimination by reaching populations living in vulnerable conditions. We heard about national experiences that having a great impact in accelerating the elimination of these diseases in Suriname and other countries. In addition, we saw the high impact of cost-effective measures to avoid and eliminate disease amongst vulnerable populations. And finally, we saw a commitment, a sustained political commitment to ensure that nobody's left behind in the elimination of diseases through multilateral collaboration. The session also included a ceremony recognizing Suriname for having eliminated malaria. It's the first country in the Amazonic basin that has eliminated malaria, and I'm sure it'll encourage other countries in the Amazonic basin to do so as well. We recognize Dr. Julia Esther Caballero Peralta of Peru with the PAHO Award for Health Services in Management and Leadership 2025. The award highlights the leadership of Dr. Caballero in expanding and strengthening mental health services in Peru. Member states carefully analyze the reports and progress reports on strategies or plans of action that have already been implemented or are about to be implemented. We all agree that even though we may continue to build on the basis of our collective effort, there is still a lot to be done to address the persistent challenges. A tribute to health workers across the Americas for the resilience and containment of COVID was held, and we recognized our dear Dr. Carissa Etienne, who was unable to be present yesterday but was represented by her family, And this year we were able to conclude the tribute to her, which is a very nice structure that is permanently exhibited in the lobby with the support and cooperation of the credit union of PAHO and the staff of PAHO and the World Health Organization. I would like to express particular appreciation to our chairman, distinguished Mr. Jeremy Walcott, the Minister of Health and Wellbeing of Barbados, for the firm and efficient manner in which he has presided the 62nd session of the Directing Council. Thank you for keeping us on course so that we could complete this week's agenda with respect, courtesy, and sensitivity.
To show our recognition for you, I would like to give you this token as our appreciation is to remind him all the times that he used this graphic to say the resolution was adopted. Thank you. Thank you, Minister.
I also would like to express my sincere appreciation to the chairman of the 176th Executive Committee, the Honorable Dr. Frank Anthony, Minister of Health of Guyana, and to the Vice President of the 176th Executive Committee, the Honorable Dr. Francisco Alavi, Minister of Health of El Salvador, as well as our rapporteur, Mr. Alejandro Alvarez, Attaché for Human Rights of the Permanent Mission of Chile before the OAS, for having accompanied and supported us in our valuable work done by the Council. I also would like to thank our Deputy Director, Mrs. Mary Lou Valdez, for her dedication as Secretary of the Directing Council, and I also would like to thank all the staff, including the Office of Directing Bodies, for their untiring effort and excellent contributions to ensure that the meeting this week was successful through all the preparations they did in preceding weeks. I cannot but help express our appreciation for our interpreters, without whom we would not be able to do our work in such a fluid manner. Even when we speak too fast, it's not the privilege of any nationality. I know everyone did so. There's some countries that are famous for being too fast, but I think it applies to everyone when they want to try to take as much of their time as possible. So I'd like to thank the interpreters for their excellent work. And I also would like to thank the work done by the translators who have ensured that all the documents for the meeting were made available in the 4 official languages in time to be reviewed by member states. Today, in saying farewell, I'd like to respectfully ask that we renew our commitment to the Pan-American values of excellence, solidarity, respect, and integrity. Once more, I congratulate all of you for your commitment to excellence and to the deliberations this week. During these past days, you have approved resolutions that clearly indicate to the Secretariat what should be the priorities, what are the challenges we are facing, and how we should guide and orient our technical cooperation. And you can be assured that, as always, in this organization, the Secretariat does not make isolated decisions. We do not create agendas. The Secretariat does not deviate from the ethical values, the values that are the commitment of Pan-Americanism, solidarity, transparency, the effort to seek efficiency and provide the best technical cooperation that we can offer to our member states. We always work in that way, and we will continue doing exactly the same thing, because that's the most important, since it respects the decisions that you make, and we are committed to transform into concrete action in each one of our countries, and member states of the organization. Thank you very much again, and I wish you a very successful trip home.
Thank you, thank you, Dr. Barbosa. I am supposed to make a few remarks, but I wonder if there's anything left for me to say, or if you've had enough of me for the past few days. Dr. Barbosa, Director of PAHO, Honorable Ministers, Mrs. Lou Valdez, Deputy Director, Dr. Rhonda Seeley-Thomas, Assistant Director, Dr. Frank Anthony, Chair of the Executive Board and Minister of Guyana, Mr. Alexander Alvarez, who was going to read his statement as he would read his ID, the Vice Presidents of Peru and Argentina, and Mr. Nicolas Lagomarsino, distinguished delegates, members of the hard-working PAHO Secretariat. As we conclude this Directing Council, the 62nd Directing Council, I want you all to take a moment just to reflect on the depth and the breadth of our discussions and what we were able to achieve over the past 4 days. I think you should all give yourself a round of applause. We are finishing on Thursday when we were supposed to be finishing tomorrow. So I think you have all done very well. We have been able to navigate a very complex and indeed ambitious agenda, and one that speaks to the continuing evolving challenges throughout the region and of opportunities as it relates to collaboration and cooperation across our region of the Americas to address some of these challenges and to solve some of our problems. As the Director said earlier, we have done a number of important resolutions: the strategic plan for Pan American Health Organization, the resolution related to the program budget, the one for policy of expanding equitable access to high-cost and high-priced technologies, and of course, a plan of action on non-communicable disease and prevention and control. 4 very important resolutions, not only for PAHO, but indeed for this entire region of the Americas. In closing, and I am going to be extremely brief, I want to thank each of you for your active participation, your meaningful interventions, and your obvious dedication and indeed cooperation throughout this week in making this a very successful Directing Council, which I requested when I spoke at the opening. It would, of course, be remiss of me not to thank Nicholas and the governing body and the hard-working Secretariat who have been helping to make this a very successful meeting. It's left for me just to wish all of you a very safe journey home, and I now declare the 62nd Directing Council of PAHO ended. I'm not finished. Apparently, I'm not finished. I want to inform you, members of the Executive Committee, that you'll be meeting in 15 minutes. It's now 3:45 at 4 p.m. in committee in room B. And of course, there's coffee downstairs. So you can grab a cup of coffee. And those of you who are the Executive Committee, we continue working 4 p.m. room B. Thank you.